where she's more, you know, we're working under her. So we're always deferring to her. Like she said, she's in 3 rooms. I'm calling for an exam over here. Her head's got to be in like 4 different patients' heads. So her day-to-day is much more hectic, where I get to sit down and like focus on a patient. And I'm having one-on-one conversation for 40, 50, our new patient appointments are 90 minutes. So like I'm really building that bond with patients.
Right.
And then I have to come in and transfer that
it's
bond
very,
to her.
like we talked about earlier, like the nurse, and the nurse really builds that bond.
Mm-hmm.
But that being said, how much patient time or do you have? And I guess when you do have it, it's probably more niche.
Right. So Kelsey has her full like 60 to 80 minutes with the patient, and then I've got those last 5 to 10 when I come in to diagnose. So the patient trusts Kelsey. She's, you know, they've talked about their life, about their experiences and everything. I have to catch up. So Kelsey does a really good job of catching me up really quick in front of the patient. And she'll tell her, we talked about this is what she's got planned for next weekend.
Nice.
We noticed, we'll do all that. And then she'll get into diving deep about, but we did notice she's got gum disease. We did notice that this tooth is hurting her, that kind of thing. Okay. So the thing for me is I have to connect with the patient really quick. Yeah. Congratulate them on the wedding, you know, be excited about their vacation. But then if me and Kelsey were not aligned and she was telling the patient like, oh, don't worry about that. Yeah. So we
and then she's like, no, you've got 5 cavities.
Yeah. So we spend a lot of time when we're training and when we're, you know, doing team meetings on this is what, if I see this, I'll typically diagnose this. And this is why. So they know. So they can kind of be like, you know, usually when doctor sees that, that's going to turn out to be a crown. We'll let her come diagnose it, but just so you know that's what I'm seeing. That way the patient's already seen it once. They understand it, and they already trust Kelsey to tell them the right information. Right. That's what really makes my job easier. Yeah. And that's why it's so important to have team members and staff that are on the same page.
Welcome, guys, to another episode of Consciously Curious, where we dissect those that are thriving in their passion. On today's episode, we have Dr. Tasha Dhir
Thanks
from
for having me.
Family Dental in Orland Park.
Yep.
And then her dental hygienist, Kelsey Dalke.
Yes.
So we're going to dive deep into the world of dentistry. So I feel super grateful for you guys to come on, spend some time on the Saturday morning, and come on.
No problem. So Thank you so much for having us.
Awesome.
I'm super excited.
Let's start with, how long have you guys been in the industry for?
So I graduated just over 3 years ago now. I graduated in May 2016. And I've been working pretty much that entire time at the same office. Okay.
What about you, Kelsey?
So I graduated May 2014, so I've been doing this for 5 years now. Oh. I know, it's crazy. Got a little shorter education, though, than doctor. Yeah. And I've kind of been all over the place. I've been with Dr. Dhir now almost coming up on a year, but I've probably worked at 4 or 5 different offices.
Wow,
yeah,
really?
So it's different. And within those offices, one was a smaller like corporation, so I was popping around different offices. But yeah, and then I was an assistant shortly after school too, so I got a little bit of both.
Okay, great. What got you guys into dentistry?
So I don't have the typical story of like, I knew growing up this is what I wanted to do. Yeah. I always knew I wanted to be in healthcare. Okay. So I lifeguarded while I was in high school and in my undergrad. Went into undergraduate thinking I was going to go to medical school. Shadowed a couple of general physicians and absolutely hated it. It was just too boring for me. So I started shadowing pharmacists, optometrists. Finally, when I got to my dentist, that was like the moment I knew, just because he was always on his feet, working with his hands, helping people get out of pain right away, and that was the one thing for me. Growing up, I loved arts and crafts, working with my hands. I can't sit behind a computer all day. I'll get nothing done. So I need to be interacting with people and like getting end product.
You just described an ER doc.
Without the pressure, though. Like
without them, okay.
Yeah. So I like that. My favorite thing, they always ask me what my favorite thing about my day is when a patient comes to me in pain and then they leave smiling and it's only been like an hour, which is like, I feel like not a lot of people can do that.
No.
It's a really cool.
As a paramedic, it's rare. I mean, that's our goal as well, but like, yeah, we don't always succeed.
It's a really cool feeling.
Okay. And, for sure. And you, what got you into hygiene or dentistry in general?
So I started at UIC actually in an engineering major. Hey. UIC. So I quickly realized the engineering I was going into would have been, I was in industrial engineering, and I felt like it would have been firing a lot of people.
Wow.
And I don't think I could do that. I don't think I could stare at someone and be like, oh, you have 4 kids. Today's your last day.
Really?
Yeah. I just, it's basically, industrial engineering is trying to get companies to work better.
Okay.
So I feel like that has a lot to do with like cutting and changing.
Sure.
And,
Efficiency. And all.
Exactly.
Yeah.
And I mean, I'm all for efficiency, but it just didn't seem like the right fit for me. Plus, like physics. Ugh. So I kind of like had to reevaluate everything. And in middle school, my mom was a single mom, worked her butt off, no dental insurance, got me braces. I had a lot of crowding, really bad bite.
Yeah.
And I just saw like the power of a smile, as cliche as that sounds.
Yeah,
I didn't used to smile a lot. I didn't used to, giggle and just, I got even louder when I got my teeth fixed. But I mean, it really does, like that smile makeover and fixing a smile and gaining that confidence is really, it's life-changing. You do change people's lives. And I kind of dabbled into like just dental in general. And then I found the dental hygienist role by really like just searching online and luck.
Right.
And it was middle of my freshman year in college. I was like, cool, it's an associate's degree. So I was like, I still finish in the 4-year time, not extending my education. So kind of just went for it, really. And then one day it just kind of clicked in school.
Yeah.
I found out about the oral systemic health, and that really like is what drove me to
how important
be
teeth
passionate
and gums
about
and
it.
gum health like play
Exactly.
in the overall health. Yeah.
Exactly.
Okay.
Like the mouth is the gateway to your body. You breathe, eat, drink through your mouth. So if you have an infection in your mouth,
it can lead to other things. Yeah.
Exactly.
So, but why not go full out, like all out dentistry school?
Quite frankly, when I was younger, I just didn't really want the responsibility of being a doctor.
Which is fine, yeah.
Yeah, it was like, it still is pretty lucrative. You can still like be well off on your own with an associate's degree, which is really nice
How many other professions can say that?
Exactly.
It's true.
Exactly.
Yeah,
like I live alone. I have a home in Tinley.
Wow.
Like I still am doing my thing. And I mean, granted, I think Dr. Dhir could speak on this. I do push myself more than, like, you could either work part-time and just be good, but I do have multiple jobs. I am trying to go into research. I'm doing stuff that is keeping me still afloat even on, hard days. So.
There's a lot you can do with dental hygiene too, though.
Yeah.
Like Kelsey's doing her master's in public health, so you can go into teaching, you can go into public health.
Yeah.
You don't have to just be doing the clinical side of it,
Okay.
which I think is really cool and unique to dentistry in general, because same with dentists, you don't have to be in the clinical spot of it either. You can be a professor, you can be doing like mobile clinics, you can be doing mission trips. Like there's just so many different sides of dentistry that you can dive into if you don't just like the day-to-day,
Which I had no idea. That's awesome.
Yeah.
Did you do anything prior to going to dental school to like set you up for dental school at all, or to maybe like get your feet wet in the field?
Dentistry?
Yeah.
During my undergraduate, not so much, but during dental school, I did do a trip to Ecuador. And that's before you get into clinics, so you haven't really seen a lot of patients yet, which is really cool because you're trying your first things hands-on with a mentor over your shoulder.
Yeah.
I did a lot of shadowing during my undergraduate just because you can't do much without a license, but assisting and just asking a whole bunch of questions and being in the dental office was pretty eye-opening, because I feel like if you go to dental school and you get into this and you don't know what your day-to-day is going to be like, you can be really surprised. It's actually a lot more strenuous than people think.
Okay. Like being a dentist overall?
Yeah.
Okay.
Like, you can ask my husband firsthand. My first year of working full-time, every day I would come home. Like, I stopped going to the gym for a couple of months, and I'm diehard about going to the gym 4 times a week. I wasn't going. I would be in bed by like 9 o'clock, and my body was just exhausted because you're on all day having to give the patients your full attention.
Right.
And your body's in all these weird positions, and then I'm juggling 3 of my own patients and checking on the hygienist patients for their exams. So it's just like your mind is on the whole day, and you're running back and forth. And until you're used to that, which took me a couple of months, it's really tiring.
Right. So, and if you don't keep yourself in check, that leads to burnout.
Definitely.
Okay. So is that true when like the suicide rates or the burnout rates are extremely high in dentistry?
That's what the stats say.
Yeah. I've never actually asked the dentist, so I'm not sure.
So when I speak to older dentists who've been in their role 20, 30 years, a lot of it is patient stress, like we really, really care about how our patients are feeling. So like I'll have a hard time sleeping if I know like, oh, that patient's still going to be in pain because that extraction was really hard. It's just one of those things where I hold myself accountable a lot. So it's that side of it. And it's also for people who own their own office. So you're first and foremost a practice owner, you're a business owner, and you're managing people, which we don't even get 1 minute of instruction on in dental school. So you get on the job and they're like, okay, now you are going to be in charge of these people's jobs as well.
Right.
So I don't know if it's the dental part of it. I think it's just kind of all
that
together,
makes sense,
just because so much responsibility of so many different things.
Yeah.
We also get to hear like a dozen times a day, like, I hate seeing you. And like
that's the first
we get
thing.
to laugh it off, but
I hate
subconsciously gets I hate seeing. It's not you, but I hate being here. I hate seeing
and
you.
Are these first time clients or repeat clients?
Yeah, like they're like, so like I'm excited to update you on my daughter's college education, blah blah blah. But I hate getting a cleaning. I hate getting a filling. I hate this. I hate that. And I mean, like I said, we're pretty good at shaking it off, but still subconsciously hearing that all day.
Oh, yeah.
I think it gets to you, just being like, I hate seeing you. And you're like, I'm happy you're here.
Yeah.
I'm happy I get to take care of you.
But like even after doing such a good job, like what comes to mind is my current dentist and hygienist. They don't do like, no matter how bad, and not just like me personally, but like how bad like you maybe neglected your oral hygiene, it's like they don't shame you, right? So like they make you feel, they welcome you, like, and then they keep it painless and all that. So like my experience has been amazing with my current office, but
most people will only come when they need something. They're in pain, or they're noticing their gums are bleeding, or they have bad breath. So you're coming with already a problem, whereas
you should be coming at least twice.
And the general public does not realize how important it is to come to those, routine exams, because you're screening for bigger problems. It's like if you only went to your doctor when you felt you were having a heart attack or your stomach's hurting. Of course, you're going to hate going to the doctor. But if you go for your routine physicals and you're making sure that everything's in check, it's a super easy appointment.
There's a lot of mindset that comes to it of like a lot of this stuff is out of your hands. So you will smile it off and shake it off and just realize like even though it can get to you, you shouldn't let it, or like find other outlets to get the stress out.
Exactly.
Okay.
And I mean, we're young enough where I feel like we're both like, exactly. And most of our patients are happy at the end.
Right.
But I feel like old school dentistry has set us up for just this underlying fear of just, the foot on the chest extractions that used to happen and no anesthetic and things like that.
Right.
And dentistry just in the last 15 years has taken such a turn. Everything is supposed to be low stress, no pain.
Right.
That's really what we strive for. But everyone hears the stories of back in the day, or they're just a little older and that's what they experienced.
Right.
And you can't blame them for having those fears. And even if it is something that hasn't happened to them personally and it is a quote unquote irrational fear. I mean, I have irrational fears too. It's just not the dentist. So
whales in the lake. Sharks in the lake.
Exactly. The Loch Ness monster or whatever that is. So we're battling that all day, every day, which can be emotionally draining. It's never even really a physical tired. Like almost everyone in our gym goes, or everyone who works with us goes to the gym. We still are working our bodies out. It's more of a okay. I could breathe now type thing.
But you can also spin that as a positive, because I feel like that also pushes us. Like we have a morning huddle in the morning before any patient comes in, and we'll talk about, that patient's really nervous, or that patient, her daughter just got married, so make sure we congratulate her, because we want patients to know, like, we're not just looking at you as 32 teeth.
Oh, yeah.
And we care about you, and I'll tell them, if you even feel one little bit of pressure or something that hurts, stop me. I have no problem giving you more anesthetic.
Wow.
I can give you so much more than I've given you. So we're going to make sure everyone's comfortable before we start. So then that's what's really rewarding for us, because then we have patients who are like, I've never had such a positive experience before. This is where I'm going to come from now on.
Yeah.
Or I've never had anyone clean my teeth so gently and then get a filling right after, and it was all in an hour, and it wasn't even an impact on my day. Those are the kind of things that I feel like are the reason we love coming. I mean, I can speak for Kelsey because I know exactly, she says the same thing to me, but every morning when I go to work, like, I love going to work. Whether, it's a really busy day or just a couple of patients, like, we actually love our jobs.
Yeah.
which I don't think a lot of people can say that.
Yes.
No, a lot of people don't say that.
Yeah.
And that's kind of the point of this podcast is like, even if like maybe you are in school and you don't know what you want to do, this is for that, or you're in like a job that you dread going to, and then you want to make a pivot.
Right.
So I want to talk about the points leading up to school.
Okay.
Was it hard to get in? What did you have to do to get in? Like maybe boost your resume or extracurriculars? Like what things did you feel like you needed to get in?
So I'll start by saying it's really, really competitive.
Yeah.
You have to really plan ahead because you want to take all the right prerequisites. So you want to be in a 4-year college to get into dental school. You want to make sure that you're looking ahead to what the dental school prerequisites are. So you want calculus, physics, biology, all that kind of thing. Does it follow the pre-med track, or is there a pre-dental track? It's pretty similar.
Okay.
It's very similar. Yeah, there's maybe a couple of courses that you can substitute, but pretty much pre-med.
Okay.
But a lot of people don't realize that you don't have to major in biology or chemistry. I had some English majors, some business majors in my class.
I love that, yeah.
So, I mean, a big recommendation I always give to people in high school is do what you actually love doing and pick a undergraduate that's going to let you have a lot of electives so you can squeeze those biologies and chemistries in so you have the prerequisites, but you're still going to get your great grades because you love the program that you're in.
Right.
So prerequisites are really important, and then maintaining a high GPA. I think to get an interview my year, which has now been so long since I interviewed, but was about a 3.6 to 3.7 to get the interview. And then from there on out, they don't look at your grades anymore. It's all based on how your interview goes.
Okay.
And then...
Yeah, but you can't even get that, it's like without the GPA.
That's to open the door.
Like they don't even like look at your thing. Like the computer will like just move you out. And
exactly.
filter you out, yeah.
Mm-hmm. And a lot of what I've heard as feedback for what they like is someone who's personable, because you can have the most book smart person, but if you can't interact with people, you're going to be a lousy dentist because you can't talk to your patients.
And do you think it's too high of an expectation to have that going into dental school? I feel like that's a skill maybe to develop in dental school. I mean, I'm not saying it's a bad thing to have it. I'm just saying maybe like, is it too high of an expectation to...
I don't think so.
Oh, okay.
Because... that's what they're screening for in the interview. Like, during my interview, it was very conversational. It was asking about my experiences. It was kind of like this, just like a chat.
Yeah.
And if I was going to be sitting there, like, straight and nervous and not being able to talk to them, how would I ever talk to a patient, in my opinion?
It's interesting. I mean, there's a lot of pressure in the interview.
The interview...
With the patient, it is more of a discussion. But if you treated the interview like a discussion, maybe you'd naturally open up then. Yeah.
Yep. And then on top of that, like, of course, grades are important, but extracurriculars are so important. So I was involved in, a lot of sports, and then you want to be involved in other clubs. So I was in the pre-dental club. I used to play music in high school. I used to play the clarinet and saxophone. Played competitive soccer, just so that you show that you're a well-rounded person. You're not just focused on this one thing.
These are things that you love. Like, I come across a lot of students that go into pre-med clubs just to put it on their resume, or take our EMT class just to put it on their resume. It's not like they never get their license. They just want to, I took an EMT class, so
exactly.
So do it because you want to do it.
For sure.
Right? That
is the main. If they take away one thing from like applying to all this stuff and trying to get into the field, make sure you absolutely love it.
Yeah.
Because you're doing this for the next 30 years.
Yeah.
So if you're just doing it for the title, you're not going to get very far with it.
Did your parents ever steer you in any direction growing up?
That was the one thing that I will always thank my parents for. They didn't, which is very rare for traditional Indian parents.
Oh, I relate.
But they actually thought I was kind of the weirdo because my dad's in technology, my mom's in finance, my brother wanted to go to law. All my aunts and uncles are working in banks and that kind of thing. Okay. And then I pop up and I'm like, I want to major in biology. This is what I want to do. And Mom was like, what? We don't do science in this family. What do you want to do with that? I'm like, I'm going to be a doctor one day because this is when I wanted to go to med school. Yeah. They were like, okay. So they pretty much have no idea. Like, I didn't have a true... I'm the oldest in my family, so I don't have any older cousins or older siblings to look to, so I had to kind of guide my own track.
Right.
So they couldn't really help me that much with, figuring out how to apply and what I needed to do.
Right.
So a lot of that came by myself, but, I mean, they're so happy for me now. They're really proud of me and everything. But amazing. I remember that first day when I was applying to colleges and I'm applying to biomedical science or biology, they were like, do it. We're totally encouraging, but we can't be of that much help.
That's awesome.
Yeah.
That's good to hear. It's not the case, like you said, but good to hear.
Mm-hmm.
Kelsey, how about you? How your intro into it and the process of applying and getting into it?
Mm-hmm. So it sounds super easy explaining it as like an associate's degree, I feel like. However, I mean, I was here at UIC, a highly recognizable college, on an engineering scholarship, and I was waitlisted. So it is actually really competitive, just like dental school.
Okay.
There isn't many hygiene schools actually in Illinois. There's College of DuPage. There's Prairie State, which is in on Halstead, super south. And then there's a couple up north. And then where I went was down by Eastern Illinois.
Okay.
Then there's one by UIC, the Champaign, Urbana. And then you go to Southern Illinois, too. And that's a 4-year degree, actually, there.
Oh, okay.
So there is a 4-year option. But, yeah, it's basically like a point system. It's like every class you've taken on their prereq list, if you get an A, you get 4 points. If you get a B, you get 2 points. So it's kind of GPA. And then you could do other things, too, like extracurriculars. I was always involved in Special Olympics, things like that. I got points for that. I got points for being in UIC at first and then coming here. And then really it's like they laid everything out, and it was just the highest points. Got the first, for us, it was 26 that were accepted in each year. So the highest 26 got
small
it.
Class.
Yep. Very small classes. And you are with those girls the whole time.
I heard
same
that.
teachers.
It's primarily, is that same with dental school as well? It's like primarily female, or?
Actually, until my year, it has always been male dominated.
Oh, okay.
My year was the first year that we had more women. So, and I don't think it was by too many. We had about 103 in my class. I want to say maybe it was like 60-40 around there, but we were the first class that had that at my school.
I think what I was reading was more for the hygienist, right?
Yes.
It's more female dominated.
Yes.
It's kind of similar to nursing. I mean, if you look at nursing, it's mostly females too. When I go back and speak with my classes still now, they like kind of have me come in and talk about the process after school with them. And I finally saw a guy in the class. I was like, oh, welcome. How does it feel to be surrounded by women all day? And like in our office, our manager's a man, and he's surrounded by 11 women.
Yep, our entire team is girl except for him.
Yep.
He secretly loves it, though.
Yeah, he does. He does. So it is really competitive, though, and I was like number 2 on the list, and it's really cool. Really hands-on, like she said. It's really prereqs and really knowing you want to have that passion. And the same thing also, it's a little less. There's no interview, so it's a little less on the personality. But we have an exit interview. And when I went to my exit interview, they sat me down and were like, this is more to say about bedside manner. And they're like, for you, we're fine. Like, they're like, you can talk to a wall. So they're like, good job. You graduated. High five. And that was my exit interview. But it is more for those people who are super smart. And then sometimes it gets in the way of them being able to communicate to the general public that we can't be using, dental terms. If I did that,
if they didn't understand, it just goes right over their head.
I mean, I've worked with doctors before that had no bedside manner, and they were confusing me, telling me what was going on, and then I'd have to transfer
someone without any medical.
Exactly. And I'm sitting there, I'm like, oh, what is he going on? Like, I'm trying to chart it for him. I'm like, what's going on? So it's really cool. It is cool. It is, like we said, it is a little easier, of course. We're not the dentist, not the doctor. But it's still really highly competitive, very similar to RN, degree. It's not as intense as a doctor, but it's still up there. And then we have, just as doctor does, after school you still have to pass your boards.
Okay.
So there's 3 boards for hygiene. How many boards did you have to do?
We have to do 3 as well.
Okay, yeah. So there's
that's intense.
Exactly. There's the clinical, hands-on, have to clean a mouth in front of like ADHA people come in and check us. And then there's a big old like 415 question, anything and everything we've talked about in the last 2 years.
415?
In 2 halves.
Yeah.
I guess it makes it better. And then there's more of like a clinical written one that's got like radiographs and case studies and stuff like
critical
that.
Thinking there.
And then you have to pass all 3 and then submit for licensure.
Are these 2 different sittings, 3 different sittings?
3.
3 different sittings.
3 different sittings, yep.
That's intense.
It is, yep. And it's not all, like, the Midwest is pretty acceptable throughout, because if I wanted to practice like in Indiana or Iowa or something like that, I'd have to go get my Iowa license.
Gotcha.
Right.
I can't just cross a border and start practicing. You do have to transfer. Sometimes there's tests in transferring also.
Higher standards and things like that.
Exactly.
I get it.
And it's more like a jurisprudence test normally. Like, I can't give anesthetic in Indiana, but I numb up all day in our office. So,
Okay.
And that's state by state, I think.
Okay.
Correct.
Talk about the experiences within school. We'll start with Kelsey.
Yeah.
So, highs and lows. What were your, most memorable moments or some frustrations about it?
Absolutely. Well, of course, making friends is always going to be a high one. I still have a best friend who works with one of our sister offices actually down in Champaign, and we're still close to this day. When I moved into my new house, she came up and helped me move. Like, we'll be eventually standing up to each other's weddings. So, of course, friendship's going to be top one.
Especially with a tight class.
Exactly. When it's 26 girls, and I think it dropped down to 24 or 23.
That's not bad at all.
By the time we graduated, you know everything about each other by the end of that.
Right.
So, of course, friendships, and also, like, the teachers. I still keep in touch with most of my teachers, especially going to the masters and progressing my education. It's really nice to kind of see their end of it.
Right.
And then the lows, of course, it's really just stress related.
So would you extend the program to like a 3-year program, or like maybe that 4-year program in Southern? Like, should it be a 3 or 4-year program?
I mean, it's one of those things where I see arguments for both of them. We're not doctors. I feel as though I got a very thorough education. Now that I'm been practicing for a while, and in a previous job, I was actually in charge of hiring hygienists. I did notice that I felt that my education was a little higher than some of the schools around here. So I think it's a school-by-school basis, just as anything is. Yeah. But we are medically, in charge. I am giving anesthetic. I am using needles. I am going into someone's underneath their gums, and disinfecting their gums. So I do totally see the argument for 4 years, because it is an intense job. It is not just, cleaning teeth. It's a lot more than that. When I'm underneath gums, for lack of a better word, it's the blind shot of what I'm doing. I can't see anything. I don't have x-ray vision with my eyes, so you just have to kind of know what you're doing. So, I mean, more practice is always better, in my opinion. I had to clean 137 patients before I could graduate.
Wow.
So that was really intense.
Such a weird number. Wait, what?
Yeah, I don't know how they came up with that.
There's always some big fancy calculation.
Yeah, there's something about it, and certain ones have to have tartar under the gums.
Mastery after 137 patients.
136, not good.
Yeah, can't cut it. You have to come back a semester. So, I mean, it's weird, and like you said, there's probably some scientific calculation behind that. But yeah, for me, being down south especially, I was working on the general public, so when people would cancel, that was messing with me hitting my standards that I have to go to. And I didn't have hey, Victor, can you come in today for cleaning it too?
You can't rely on friends and family.
Exactly, when I was down south, which was my choice, of course, to not go to a school around here. But that was my personal biggest struggles. I didn't feel like I had the support system that everyone else who was from around there, they could call Aunt Cindy and Cousin John.
With that, it's there's less pressure to perform if you're working on a stranger, I guess.
I love working on strangers. There's nothing worse than working on your family, as much as I love them.
Yep.
Because it's any little twinge or sensation, they're ooh, 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 and I'm like, okay, you're gonna feel me. I am doing something on your body. Tell me if it's in pain for sure. Doctor said, we never want people in pain, but my mom is I love her to death, but she's my worst patient, because I mean, I just hear every little comment. And I'm like, oh my gosh, can I just get through this? It's going to be over if you just talk less type thing. Right. So yeah, and exactly. It's bittersweet, and I'm very happy that I'm done with schooling.
Yes.
Okay.
Totally agree with that.
Yes.
What was the percentage of the cognitive versus the psychomotor? Should you did you wish that you would have started the clinicals earlier, maybe?
So we start clinicals right away.
Oh, there you go. Okay.
But it's on dummies at first.
Sure.
So the gums are literally rubber, so it's not the same. Yeah. There's no tongue, there's no saliva, there's no cheeks, there's no moving, there's no nervous twitches. I mean, I had a patient the other day that her child climbed on her mid-cleaning because she wanted, because the kid was getting antsy. Sure. It was a longer appointment.
Sure. Yeah.
And I can't stop that. So I'm just cleaning, and it's moving back and forth. I'm all right, let's do this. So, I mean, yes and no. We practice on each other first. So that's a great experience.
What?
Nice and painful, but you learn the best and You know, someone's doing a competency on you, and the teacher will be like, "Oh, is it feeling okay?" You're like, "It feels great," and they walk away. I'm like, "That hurts so bad." Like, what are you doing? But you know,
you're trying to help each other out.
Exactly. Like, oh, that was
that's so funny.
It felt so good, and they walk away. I'm like, bruised.
Oh, no.
Hurt me so bad. But yeah, we're each other's dummies first. I'm sure with dental it's the same thing.
Is that kind of standard across the board? You're working on each other?
We did a lot of dummy work for
Okay.
so first and second year dental school are very book and
Similar
lecture.
to med school, yeah,
Exactly. You're getting all your theory work. In between the middle of second year, you start working on dummies and on plastic teeth and that kind of thing. You're doing a lot of plastic teeth during that year. And then third year is when you start to go into clinicals. Third and fourth year are your main clinical years, when you're doing a little bit of the lecture still. But on each other, we learned anesthesia first, which was so traumatic for me because I had never had an intraoral
on yourself.
procedure done on myself.
Okay.
So my poor roommate had to give me my first injection, and I was just like clutching onto the chair. But in terms of doing, we can.
I had no fillings going to hygiene school, so same. It was like, this is the first shot I've ever had in my mouth, and this is your first shot.
Yeah, so that was a little stressful.
So you're just like, it's like open wide. You're like.
And then we had to get certified in all the hygiene things as well. So we did do that on each other. But most things were on plastic teeth or on the dummies for our competencies and for our exams. Our boards were like root canals we did on plastic teeth for the boards. But then everything else we had to get a patient.
You had to get your own.
We had to get a patient, yeah. And that is one of the things I think dental students hate the most about boards. Because you need a specific subset of people. You need so for the cleaning, you need to have a certain level of tartar underneath the gum, so certain surfaces, and you have to have the right medical history. So you're like finding this one diamond in the rough.
What if you're not in maybe an underserved area or how that'll be hard to get the patients then.
Start get people in.
What if you're in a super rural area?
Yeah, you start screening.
Yeah,
fast.
a lot of my classmates and other people taking the boards pay their patients a lot of money to have them come because this is the difference between you getting your license or not.
Oh.
And some people
passing
take off work to come and things like that.
Yeah.
So one of the girls I graduated with paid her patient $800 to come to boards.
Oh wow.
Because the lady's main argument was I have to take off a day of work.
It's true. Yeah.
And so it's like, okay, what do I do? Not get my license? Or pay $800.
Wow.
And then sometimes you use more than one patient because my cleaning patient didn't also need the kinds of cavities that I needed. So I had 3 different patients. You need to do a cavity on a front tooth, a cavity on a back tooth, and then you need to do a cleaning. And that's all in one day. So it is the longest 8-hour day ever.
Wow.
Because you are so stressed the entire time. And they check every step.
Yeah.
So.
Yeah, the prep step.
Yeah, so boards was crazy, but I'm originally from Canada, and Minnesota accepts the Canadian boards, and the Canadian boards are completely different. Canadian boards are one weekend. The first day is just all of the written and the bookwork. Second day is an OSCE, so you're going from different stations and looking at models and answering questions clinically that way.
Sure.
So I've heard rumors that that's the way the state exams are going to go in the future, but I just don't know when. But I think that's going to be a step in the right direction just because I feel so bad for all fourth-year students trying to find all these patients and paying all that money and trying to... Yeah.
I did not know that.
And most people in school, you're not having...
you
can't have that job, the full-time job, while doing school because your clinic, you're normally, at least the way ours was, we were in class from 8 to noon.
Yeah.
And then from 1 to 5 and 5 to 9 were clinics. So you're in
There's
there.
no way.
Yep. You're not, oh, I just have work tonight.
Yeah.
I'm in clinic tonight. And we're working at no charge, of course, because you're a student. So it's normally a jobless time of life.
So is this, you had to pull out all these loans to make ends meet for both of you guys?
Well, I was lucky enough. My parents put away money back in the 90s when people were making money.
Right.
That's my dad saved for me, luckily. He got me through hygiene school.
Do you know people that didn't have that opportunity?
Luckily for us, it is an associate's program,
Yeah.
so the classwork is a lot cheaper, which is nice.
Okay.
I think Moraine Valley, it's $78 an hour. If you're in the...
Yeah. That's general for
exactly.
community college, yeah.
So it's not as hefty as loans as dental school. You have to get through your bachelor's first and then do dental school. So it's doctors take a lot of sacrificial financial sacrifice, I guess is the words I'm looking for.
Sacrifice, yeah.
Yes. I think that's another misconception that we get from patients is, this is so expensive because you make a lot of money. And it's like, I think they say nowadays, a dentist, if you start now, it's $500,000 by the time you graduate.
The hole you've dug,
If you take loans for everything, it's about $500,000 that you are in debt when you graduate.
Yeah, so you're in debt for half your career, pretty much, when you're paying that back.
Good thing you love your job.
and it is worth it. Exactly. Like, as long as you're in it for the right reasons, it's totally worth it, because if you have to take out loans for anything, it's going to be
something you enjoy.
Yeah,
okay.
Yeah. Exactly.
So what were the highs and lows for you for dental school?
Lows were probably just the first 2 years of having to do the grind. Our lab was in the basement, so we called it the dungeon.
Yeah.
So second year, lab is open from 6 a.m. to midnight. You would go early before class, start doing your lab work, go to class all day, and then you would stay there till midnight. Own time. Yeah, to get your projects done.
Oh.
The requirements for your classes in first and second year are to the millimeter. So when you're doing a crown prep or a filling prep, getting it done, when you're an actual dentist, you follow the cavity and you can do it. You know the general shape, but there's no like set guideline of it has to be exactly the size.
Right.
When you're doing an ideal prep in dental school, if you're off by more than a millimeter, you automatically fail it.
You got to know the rules before you can break the rules.
Exactly. So they're very strict about what you need. So you're still learning your hand skills. Like you're not used to working on millimeter increments at that point. Mm-hmm. So we all spent a lot of time in lab. And I would say, although it made us so much better, I would never want to do that again. Absolutely not. It was very stressful.
Do you think it was a necessary evil?
Definitely.
Okay.
Yeah.
All right.
Definitely. Okay. If you don't have that, there's no way you can go work on patients the next year with confidence, for sure. So definitely a low, but necessary. A
necessary low, yeah.
A high would probably be, same as Kelsey said, the relationships. Some of my best friends that I have to this day are my dental school friends, just because we went through so much together. It's 4 years of, you're with the same people day in and day out, going through the same stresses, the same highs, the same lows. So after a big test, my class was really, really tight-knit. All of us would go out to the bars and hang out and have darties and that kind of thing. So to this day, like bachelor parties, we're having a lot of our dental school friends come because we got so close.
For sure.
So definitely relationships is
I love that.
Pretty key.
Is there anything you guys would change about the programs or add or take away?
I don't know. Yeah,
it's a tough question.
I feel like I received good education.
If you were to make an ideal program,
so we have all the prerequisites that I discussed earlier.
Yeah.
And then first year is pretty much reviewing all of them all over again. So I think if we push dental school back, I would still keep it 4 years, but I would start in first year doing more of the lab work. So second year is not so crammed. And then maybe start seeing patients in 2.5 years, or 1.5 years instead of sooner, at the third year.
Yeah.
I just feel like we've already done all the prerequisites. We know all that stuff.
Okay.
Why do we need to do it? We review it all over again.
That'd be great. Do you think programs help their students find patients? Are there programs that help their like hey, free screenings or here free cleanings or free fillings? Like are there how do they do that? Do they offer help, or is it solely on the students' shoulders, like burden on the shoulders, like to go out and find their own patients?
Kind of a mix of both. It depends on how eager you are as well. So we have screening clinic which is where all the new patients come, and there was A to F clinics for my class. They're split up into groups of 20. So like Monday morning would be, for example, my clinic A. You go to your own clinic, but if you don't have enough patients for that, when you go through that screening clinic, maybe 2 or 3 weeks in a row, it was kind of on you to try to be on the wait list for clinic B's to go screen more patients. Because maybe Monday morning isn't the day that all new patients were coming in, but that was the day you were assigned.
Okay.
So they leave it up to you, but a lot of people know about the dental school and coming for you're getting quality work because the doctors are checking everything as you're going.
Yeah.
But you're just there a little bit longer. But it's cheaper.
So coming from the patient's perspective, it's like, it's free, but like these are students. So, but like you said, like there's someone actually always checking up on.
Yeah, they always say if you have more time than you have money, the dental school's where to go, because our prices are so much cheaper just because you are spending so much time with us.
And these are people with or without insurance? Probably without insurance.
Kind of a mix, but usually without. Yeah.
Okay.
And Hygiene, at least where I went in Central Illinois, it was $25 for cleaning. X-rays included.
Oh, wow.
So it's just exactly like
discounted.
financially, like there's even patients now that if they're in our office and they are really periodontally involved and have really bad infections, we'll even say like, hey, go to the school, or even if they need a really big extraction or it's just a really big case, we'll be like, we'll just suggest it and say,
for these
for
things.
sure.
Because one, everyone needs to learn.
Right.
So those are good patients that they need to learn on. And our main focus always is getting help for the patients. So of course we want them to be our patients and I want to take care of them. I mean, I love doing cases like that. Doctor loves doing big cases, but I mean, we're human. If someone told me I needed 15 grand for my teeth, I wouldn't have that. So that's when we'll kind of be like, and not always that high of a number too, but just still it's something that financial burden is something very real in the world in general. And unfortunately, dental insurance is not the same as medical insurance.
Not at all.
It's very different. That's why I feel like dental gets the bad rep of being so expensive.
Because it's hard to get dental insurance, or what?
Because it's not required to have dental insurance.
So people are just like, wave it off.
Wave it off. And then also like medical insurance. So when they say that dental's expensive, I think about how when I had my gallbladder removed a few years back, an IV bag was $740. Like,
insane.
So the microsurgery that doctor's doing, like say I need a root canal, that is literally microsurgery. We're going by 0.2, 0.1 millimeters that she's working at. And that's going to be, $1,200. Okay. I can't disagree that you earned that. I cannot do microsurgery, like it's a crazy, crazy thing how small doctors work on. But at the same time, as a consumer, someone told me I need $1,200. I'd be like, whoa.
But that's my other thing with dental versus medical. Like when Kelsey doctor told her she needed her gallbladder out, it was out the next day.
Yep. There's no question.
Right. But for me, they're like, oh, what are my other options? Isn't an extraction cheaper? I'll just do it that way. They're shopping more for what they can, because they know they can get cheaper things. If someone told me I needed my gallbladder out, I'm not going to be like, what's my other option? Can we look at the kidney? Like, no, you're just going to listen to what the doctor says.
Right. I have some antibiotics to unflare it, things like that. Where exactly, I feel like we have to, for lack of a better word, we have to sell, which is more just education, but it's harder because it's more of a taboo of, doing this, or even x-rays, I need to do checkup x-rays. Oh, well, I've had a lot of radiation this year. Did you argue with those doctors that,
and
I need to argue x-ray your arm? Are you sure? No one ever says that.
And you get more radiation on a flight from New York to LA than you do from a full series of x-rays. Just a little tidbit.
Yep.
Fun facts.
Fun fact. And we carry around our phones with us all day, which emit radiation.
All that Bluetooth and Wi-Fi,
Exactly. I have an Apple Watch and my Apple phone in my pocket all day, which is more radiation than exactly a full series of x-rays.
So that's just lack of education, and I think schools are getting better about that. We get a lot of people in kindergarten to 6th grade now who have to come for their annual exam to start the new year.
Yeah.
So schools are trying to help, but I think the disconnect is just all these years of people not realizing, like Kelsey said earlier, your mouth is the gateway to your body. They've linked oral bacteria to heart attacks, strokes, diabetes, Alzheimer's now. There's so many things. Think about it. This is just one of your openings to your body.
Exactly.
And you don't get another set of teeth once you lose these ones. So
yeah, it's a mix of education and insurance. Right. So like the example in emergency medicine is when a chest pain patient who's completely alert and oriented decides not to take the ambulance because of the potential ambulance bill. Right. And they're like, I'll call an Uber. And what if you eventually keel over in the Uber?
In the Uber, yeah.
Exactly. And it's hard. It's really, I think that's one of the most difficult jobs.
And you want to advocate for them. You want to be the patient. You want to like empathize and be like, yeah, that ambulance bill will potentially be high, especially if you don't have insurance.
It could be life-saving, right?
But it could be life-saving.
Exactly.
So you want to help them make an informed decision.
And that's why I love the school, because those patients who generally can't afford the dental treatment are the ones who need it the most.
Okay.
So there is an outlet, there's a spot for you to go, and they're going to take such good care of you because every step is getting checked along the way. You're getting the care that you need and deserve.
Okay.
Absolutely.
And maybe not a lot of people know that, I guess. So they go in, like we said, like they go in like, oh, I don't want a student working on me. But if they know that it's not just a student, you will get a good cleaning or whatever you need. And, okay.
I mean, if anything, it's you leave anything behind on us at least.
Yeah.
Like you're getting like 10 points off here, 10 like not that I'm not taking good care now. It's just now I've accumulated enough experience that I could do a cleaning in a faster amount of time.
Mm-hmm.
That's really different. So yes, it's gonna take longer because exactly just like the first time you tie your shoes, it's gonna take you 5 minutes to tie a shoe.
Right.
I don't know any adults that take 5 minutes to tie a shoe anymore.
Right.
So it's just like any other skill, but it doesn't mean that you weren't tying your shoe when you were 3.
Yeah.
You still tied it.
Right.
It still got done.
Right.
It just took a little longer. Right. So it's just a skill. It's a learned skill.
What else can we do to spread the word then? You know how, in the community they might have like blood sugar checks or blood pressure checks, like not just you're doing like dental screenings out in the field, but like what do you set up booths to like in the community, like
We've
maybe during festivals or like, hey, go to the school if you need this or whatever,
right. We've been doing maybe quarterly free dental days at our office. So you can come in. We'll advertise in our community, like on Facebook, at the local Jewel, wherever we're going. We'll put up flyers, and we'll provide a free cleaning, a free filling, or a free extraction.
Yeah.
First come, first serve, completely free. And during that free dental day, we will screen. So we take your blood pressure. If I'm doing an extraction on the right side and I notice another bombed out tooth, I'll tell them like, hey, you need to get in for a checkup because this one's hurting you now, but in about a couple of weeks, that one's going to be hurting. So that's kind of our way of getting awareness of, hey, I know that you didn't do your 6-month cleaning for 15 years. Now it's time to get in. So they know that we're there.
Huh. Do you guys partner with like local urgent cares or hospitals that, like if they do have patients that complain of oral stuff, like dental stuff?
So our office is really trying to get more community involvement.
Right.
So you being a paramedic, that was a great idea, actually. Yeah. We have a makeshift marketing committee that I'm on. So I need to do my job a little better. But I mean, for example, we've been trying just to like give out our cards to like local businesses, but that is something that we've been trying to implement is contacting.
Well, it's not simply just giving a card, because giving a business card is like salesy, right? It's like, but like when you come off as genuinely caring for the community and you want people to be aware and educated about their oral health, that comes off organically.
Exactly.
Right. And like we said earlier, not to like negate the importance of marketing, but like good customer service and quality service goes a long way. And all the guests that I've had on have attested to the importance of word of mouth, and that's still like the bread and butter of businesses like success.
There is a dentist on every corner, so you have to set yourself apart, and the way you do that is by giving quality care.
Exactly.
Some of my most long-term patients are the patients who were referred from their brothers, sisters, cousins, and their whole family comes now because they already inherently trust their brother, and then their brother already trusts me. So when they walk in, they're like, you did a great job for him. Like, whatever you say I need. Whereas our new patients who are just coming in because they saw a flyer or they saw a discount are kind of trying us out. They're making sure that this is comfortable. It's what they expect. It's, in their budget, all that kind of stuff. That trust, you have to really work a lot harder to build it.
Yeah.
So that's the way we set ourselves apart.
How else do you stay top of mind? I mean, for my office, like I get text messages of like, hey, 6 months you're due, or like, hey, in 2 weeks you're coming. Are you still coming? And like, it's like, I'm like, yeah, no, I stay. That's how they stay top of mind. But like you guys, I guess, try to be aware of who's like your morning huddle, who comes in and what's going on in their life, that we can kind of keep like just being aware of things that like in their personal lives, like what's going on in their personal lives, and that just shows that you go like the extra mile for your clients. And like a couple guests ago, he's a bartender and he's like, guest, not customer, right? So like they're not just people paying you money for a service, but you treat them like family, you treat them like a guest in your home, and that goes a long way.
That's so important. It really is.
Okay.
Yeah, we really try to take the extra step and be like, oh, we had a patient refer a friend the other day, so I was like, oh, just a reminder, like, this patient referred them. If we send out handwritten postcards, like we really take the time. Referring your loved ones and friends is the highest compliment anyone could ever, receive. Especially children, things like that. Like, oh, my mom goes here. That's why I'm here. Yeah, you trusted us with your child.
Exactly.
It's really heartwarming. Like Doctor said, that's the relationships we go for. That's what we like to connect on people with, because exactly, we get a cleaning. I mean, we're in Orland Park. I can't even tell you how many dentists are in Orland Park.
Okay.
So we do need to set ourselves apart. And I think the true thing that sets us apart is every single person who works in our office truly cares about every single patient who walks through that door. Like, we treat them all as if they're our sister, our best friend, our mom, our grandma, whoever it is, because I would never want to put another human being in a bad position.
Right.
So
I want to feel confident that if my mom needed treatment tomorrow, she could come and see anybody in my office.
Yes.
We have 3 hygienists, and I would feel confident putting her in any of their rooms, or any of my dental assistants working on her, because that's the kind of team I need to have. If I don't feel confident with my family seeing my staff, then why would I feel comfortable with my patient?
That goes hand in hand with micromanaging, right? So if you don't trust your team, you're gonna have to feel like, I need to do everything.
Exactly.
And that's exhausting.
Especially if you own that practice. It's just like, I need to do everything because I don't trust my own team. It's like,
so like, my
awful.
dental assistants know if we have a big procedure or a patient who came in pain, 24 hours later, we're going to call them, follow up with them, see how they're healing, see how they're feeling, that kind of thing. And I feel like that's really rare these days for people to check up on each other, especially from a doctor's office. Yeah. Because so many patients walk through the door. So people really do appreciate that.
Yeah, and that goes, you don't, like, it's not like you take face shots or head shots of people. It's like, it's hard to, like, keep their faces in mind.
Well, sometimes I remember their teeth more than their faces. I'll be like, I saw you last time. And then they open up, I'm like, I remember you. I remember that tooth. And
they'll ask me, do you remember Jill so-and-so? And I'll be like, show me the x-ray. Oh, yes, that tooth. I remember Jill.
Yes. Yeah.
Okay.
But, I mean, and then everything comes flooding back in. Oh, yeah, she's got a daughter who goes to UIC and stuff like that. So it's silly, but we're teeth people. So
yeah, that's amazing.
That's how it is, yeah.
Okay. With it being oversaturated, was it hard to find a job? Or is it currently hard to find a job?
It's different for doctors and hygienists, so she can start. Yeah.
All right. Yeah.
It's hard to find a job exactly where you want it. So if you want to be working, I wanted to be very close to Chicago because I wanted to live in the city.
Sure.
That's a very specific area. So finding your exact dream job in your right location, yes, is difficult. You can find a job. There's always going to be people looking for associates or more dentists, but is it going to be the right hours for you? Is it going to be the right commute? Is it going to be the same philosophy? As an associate, you have to agree with the other doctor on their philosophy of treatment, that kind of thing. So you can always find a job. I feel like I will never be jobless. Will I always love my job if I were to move? That would be my worry.
Okay.
It just takes time to filter through and make sure I find the right office and right place.
What's the setting that is the most available then? I don't know, maybe that's super simple. Rural? Okay.
Yeah. If you go somewhere rural, your salary is a lot higher because you're 1 in 10 dentists instead of 1 in 1,000. And there's just so much need in the rural communities right now, whereas Chicago has 2 dentists on every street. There might be 1 dentist.
Yeah, you already said
Orland.
Orland is saturated. I can't imagine Chicago's.
Yeah.
Yep.
Yeah, so jobs in the city, you have to be willing to work, almost every Saturday. You have to work late evenings because it's a different clientele as well. Your patients are coming on their lunch hour or they're coming in their evening hours. So if that's not ideal for you, then maybe that's not your dream position or your dream location.
Yeah.
So it's very individualized, I would say.
Is there such a thing as like an ER dentist? There are?
Yeah, there are places. Okay. One that comes off the top of my head is a media dent. A media dent is pretty much, I'm in pain, get me out of pain now, really quick. Yeah. A misconception I want to clear up, though, is people go to the ER for tooth pain all the time. And ER doctors are not really trained in the oral cavity very much. So they can give you antibiotics, maybe numb you up, and then they're going to send you to your dentist anyways. Yeah. So that's one thing people don't, first off think, okay, mouth pain, then we go to a dentist right away. So a media dentist is one that...
Which is so counterintuitive. Yep. It should be intuitive, but like, why aren't people thinking?
I don't know. I have at least one patient a week say, oh, I was in the ER over the weekend, and I'm like, what'd they do for you? Gave me antibiotics and told me to come see you first thing Monday morning.
Could have saved yourself a bill.
Yes. Yeah, exactly.
Yes, exactly.
But that's a thing with many patients that seek out the ER. They use it as maybe primary care as well. So there's a lot of miseducation.
So that goes back to just building that value of you have to come for your 6-month checkups. It's just so important because it sounds cheesy, but dentistry is the easiest and the cheapest today. because every month that you go forward, that cavity's getting bigger, and we're getting bigger problems, and bigger problems are more expensive to fix. And that's just the truth of it.
And then it's not just cavities, but you guys kept talking about the gateway to the rest of the body. How else can we relay that to the public? You know, like, why aren't there more PSAs about oral health and like how it leads to like a systemic issue? And I think that would help bring perspective to the public of how it is important to at least go twice a year and things like that. How else can we do that?
I wish there was a mandatory like thing that general physicians have to tell their patients at their checkups, because there is a disconnect right now between medicine and dentistry.
So maybe if you did partner with like the local like urgent care,
that would be
hospital,
a really good idea, because I'm often referring a lot of my patients back to their GP for high blood pressure, or if I'm afraid maybe they probably have diabetes. Like, we can screen for those kind of things in our office.
Really? You've taken blood sugars and blood pressure?
Not blood sugars necessarily. So we take blood pressures. Every patient that sits in my chair.
I didn't know. I've never had my blood pressure taken at a
It's
a
a new
office.
thing.
Oh,
so
okay.
the ADHA just started recommending it. And that's just because, you know, in general public, as you know, as a paramedic, you know, heart issues and diabetes type 2 are becoming the silent killers.
Yes.
So we're starting to just take blood pressures on everyone. And diabetes really, really, really affects your ability to heal.
It does.
Especially in the oral cavity.
That's how we can catch that.
See,
So,
when I think of diabetic and poor healing, it's the
Okay.
ulcers.
Yes.
And then they have to amputate, right? But like that
Your
makes so
gums
much sense.
will also
That
not heal
makes
as quick.
so much sense.
She might do an extraction, and then they come back 2 weeks later, and it's still
Bleeding.
wide
and
open and bleeding, and it's like, okay,
Open to
there's
infection.
something else going on. This is not, you know, she did everything she was supposed to do. Everything was sterile.
Yeah.
It's something, not with you, but there's another underlying issue
Right.
going on that we need to take care
Yeah,
of, because
we-
we're looking at a patient as a whole,
Yeah.
not just 32 teeth.
We're never
And
trying not to place the blame, right?
Exactly.
Why didn't you do that?
Yeah, and I mean, we're all human, you know. I mean, I think I'm overdue for my like general checkup right now, to be completely honest. So,
But and like you said, you've never had that done. But
Yeah.
the number of times I've had someone with an astronomical blood pressure in my chair, and I've had to sit down and tell them, you need to go to the hospital right now because I'm worried about you having a stroke or a heart attack in my chair, and they look at me like they've never heard that information before. I just think, what if you were driving, or you were looking after, you know, your infant grandchild? Like, this could have happened to you at any moment. Like, luckily it's happening to you here. And unfortunately, a lot of the time they don't take it seriously.
No.
We're screening for it, we're showing you the numbers, we're telling you all the risks, and then it's up to
It's an education
realize.
thing, and then it's a cultural thing as well. Some cultures just like will eat the pain until it's like worst case scenario, and then it's like an eye opener when they actually have that heart attack. It's like, oh, maybe I should monitor my diet or do my physical
high
health.
blood pressure is never an issue until you have a heart attack,
Oh my
and
God.
it's I'm sure you see it day in and day out, and it's with proper screening and education, it can be
Good for
very
you guys.
preventable.
You know, you're providing a more holistic service to these patients, and that goes hand in hand with the importance of, hey, you know, we're not just cleaning your teeth, we're not just doing fillings, we're doing so much more, because your teeth can lead to your oral health can lead to so much more.
Exactly.
Yeah, there's a lot of overlap, and maybe back in dental school and medical school they should maybe cross over each other a
And
little.
I feel like people are realizing dentistry's it's a slow process, but it's getting there. Did you see that meme recently where the guy's missing his eyebrow and he's missing a tooth, and all you can see is the big space in his mouth, and you don't even realize that the eyebrow's missing? That's how much, like, people don't realize that your teeth not only are like we were talking about medically are the gateway to your body, but it's your confidence. That's the first thing people look at when you speak, when you smile,
Right.
that kind of thing. So it can be a game changer for your whole life. You go to a job interview, missing a whole bunch of teeth, that's gonna change your image.
Yeah.
Unfortunately.
Yeah.
And that's really when I first started my process in the master's program. I started off with the education major, and I actually switched to public health because of all this underserved community and, you know, lack of education. It's, you know, we see PSAs on quitting tobacco. That's a really good example, because everyone's seen that. And not that that's a poor issue. Like, still stay on top of that. But why are there so many commercials on the new Big Mac and the 4 for $4 and, you know, the sale at Old Navy, and there's not more of these PSAs on, you know, oral health and just a bunch of stuff. And then to compound onto that, like, oral cancer is the only cancer that's increasing in rate right now.
Yep.
Really?
Everything else is either stable or decreasing.
Yep.
Okay.
And in my opinion, it's lack of education, lack of screening.
Yeah.
And oral cancer is very connected to HPV. So there was the spike of HPV when all of us were younger. That's why that Gardasil came out.
Yeah, exactly, yeah.
And all that. So everything's changing. And, you know, cancer's cancer. It's not, you know, it's a very scary thing. But we have an advanced oral cancer screening at our office. So many people brush it off.
Yeah.
Just like, oh, I'm too young.
Is it a laser thing? What is it? Yeah.
Yeah, it's just a UV light that we can see a couple of layers underneath the mucosa. So if there's any abnormal cells, it'll show up as like a dark patch for us. So some things, you know, I won't even notice when I'm just using a regular light, and then there's a weird patch. And that's great because we're catching it before it's, you know, stage 4 or something where we need to biopsy it and excise it. Yeah. So I just say, hey, it could be nothing, but it could be something. So why don't we send you to the oral surgeon, get it looked at?
Yeah.
Is this a standard across the board? Do all practices need this UV cancer
So it's not necessarily everywhere. Every office I've worked at, I've seen it's becoming much more regular with that rise of oral cancer. But exactly, our office especially, any office I've worked at for a substantial amount of time, we're always focusing on prevention, early detection, things like that, because we don't want to have to go into the root canal.
Preventative medicine is the best medicine.
Exactly. Yeah. We don't want to have to be doing all this work. We don't want to have to give you a treatment plan that's $10,000. Like we don't like doing that. That's not our goal. Like, it's super uncomfortable.
Yeah, the best appointments are when we say, you look great, you've been doing the best job at home. Yeah. Because then I don't have to break the news to you that you need more work.
Right.
But going back to the oral cancer screening, so we always do, I think across the board, any dentist will do a head and neck exam and a visual oral cancer screening. Okay. If you decide to use, like we have the Velscope, which is the UV light, or any other mechanism that helps you, that's up to you. But every dentist will be doing that head and neck exam and oral cancer screening.
So we're always looking for abnormalities.
Yeah.
Okay. Anything like that. I'm not going to just see a huge something in the back of the throat.
And leave it there. Yeah.
Yeah.
She didn't ask me to look, you know, it's not really.
Just a gander here.
Yeah. We'll address that later.
Yeah. So, yeah, exactly. Everyone's always looking, but it's so different when it's like, yes, I want to take that preventative stuff. Let's take the extra step.
Right.
Let's do the screening, you know. It's crazy. And it's, like I said, it's always mind-blowing to me that the difference and that people think that medical and dental are so
different, but they're completely aligned when you really think about it. They work hand in hand.
Yeah. So what if there was an ideal private practice with a GP and a dentist?
That would be sweet.
Yes.
That would be really cool.
Yeah.
I mean, it'd be whole body treatment.
Why isn't there a private practice with physical therapy, OT, GP, dentistry?
Big building with it all.
A big old building.
A vet for your freaking dog.
Bring in the dogs too. I mean, in theory, like, my public health brain thinks exactly we should have like these healthcare centers. Like, you go in and you start at the front desk and you give your insurance, and then you just kind of go and just
go through,
see everything.
What do I need?
Yeah.
That would be great.
And even on the medical end, I read this Time magazine, Exercise Health, and a doctor made a quote that was like, if you check your car oil more than you check out your body, that's alarming.
Oh, wow.
So think about it. We're changing our car oil about every 3 to 4 months. Even the 1 yearly prevention, like, he's like, if you have things going on, if you're diabetic, if you're, you know, you have these issues, you'd be going more often. Same thing with us. If you have cavities, if you have gum disease, if you have things like that, we want to be seeing you more because we don't want these infections getting out of control and turning into bigger things that they don't have to be, basically.
And a lot of patients' biggest gripe is dental insurance. They want it to cover everything. But dental insurance is a lot like car insurance. Like, you get into an accident, it's going to cover X amount of dollars, and then the rest is on you, depending on the plan you have. That's exactly how dental insurance is, too. So when patients see that the extraction's covered, but the root canal is not, like, I hate when they dictate their treatment based on what their insurance is going to help them out with, just because, like, you don't get another chance at getting your teeth back. You know, try to save what you can.
That's definitely the hardest day-to-day struggle is getting people to understand that, like, we're trying to give you the best treatment possible, and we're trying to set you up for lifelong success, you're human, you have autonomy. Like, I can't make you do anything. I have to give you all your options. Yeah. Exactly. But then we're human at the same time, so it's like I can't argue with you when it's, $3,000 more to do something. Mm-hmm. But at the same time, it's like, but if this is my mouth, we say this all the time. This was me. This is what I would do.
Mm-hmm. Yeah.
And unfortunately, it doesn't always withstand that, the education just doesn't get through all the time.
Well, the other hard part is, like, the doctor didn't give you an option.
Yeah.
Of, you can either get your gallbladder removed or do this. With us, there are many options that we can go through. We can do an implant. We can do a bridge. We can just leave it. We can do whatever you want.
Yeah.
Whereas a lot of other fields, you have to get the gallbladder out or you're going to be in pain. Yeah. I'm not giving you the other option.
Yeah.
Right.
So that makes it more tricky for us, too, because they're like, oh, they want me to do the bridge because it's more expensive? Mm-hmm. Do they,
But it also wouldn't be ethical to be like, you need this. And
exactly.
Not, right? And not
you
like...
have to give all your options. And we are trained to always give the option of do nothing, because that is always one of your options. Oh. And I hate giving that one because people want to do that one.
Yeah. And even with the gallbladder, I tried to leave. Literally. I was in the ER and I was like, I'm just going to go home and sleep. I'll be back at 6 a.m. for the surgery. Like, I just didn't want to sleep in a hospital.
Right.
And he literally looked at me and goes, sit down. You're staying. Like, I mean, granted, of course, if push came to shove.
For sure. You can sign.
I was 23. I could have signed a, resistance. But he was like, stop. You'll be back in 2 hours. Like, just
do it. Yeah.
Sit. And I feel like we're not able to say that, to be like, just sit down. We're going to do this right now.
Yeah.
Like,
because you're going to come to me tomorrow morning with a big swelling in your cheek.
Yeah.
People are like, when it bothers me enough, I'll be back.
Oh, man.
It doesn't hurt, so I'm not going to do it. And you're like, neither does high blood pressure. It's very similar,
That's really interesting. But I'm sure it helps when you say, like, if it was me, just try to be relatable, I guess.
Absolutely. And that's always our approach.
Yep. I will say, if you were my mom, this is what I would tell you.
Okay.
100%. Because I wouldn't do anything on a patient that I wouldn't do on my own family. So.
Yeah. Mm-hmm. More with so let's transition into, like, the day-to-day stuff. Mm-hmm. And you both of you seem like you love coming into work. Mm-hmm. And you guys have, like, the dream team squad that you work with. Mm-hmm. What are the different types of, like, practices one can come into? Mm-hmm. Different settings. You wrote an article on this.
I did.
Okay.
Yes.
So we can start with you, Kelsey.
So it's really, right now in dental, it's really like corporate versus private practice.
Okay.
And honestly, it's whatever is best for you. Like, as a hygienist, I work under Dr. Dhir. So anything I want to do, I have to pass through Dr. Dhir. She is the doctor. I cannot diagnose. I take all the diagnostics, but then she diagnoses off of it. So for a hygienist, at least, it's very, in my opinion, the most important thing is just finding doctors that you align with really well. Okay. Because I've worked for doctors before that I don't align, and they might want to either overdiagnose or underdiagnose. I've seen both.
Okay.
And that's an ethical and, like, moral struggle.
We already know how costly it can be, and when a doctor's like, get this and that, and give them everything, it's like, no, they don't need everything.
And not everyone needs that Rolls Royce treatment.
Exactly.
If you're younger, you still need treatment, but you might not need as many, we have antibiotics that go under the gums and stuff like that. So if you're a young, healthy person, you're more likely to bounce back without those antibiotics. Now, if you're a 6-year-old patient with kind of uncontrolled diabetes, high blood pressure, things like that, all right, we're going to hit you full force with everything because you're going to need help to heal. Right. We're trying to heal your body.
Right.
So the corporate versus private practice, it's kind of bittersweet. So corporate, the ups are you have that cushion. Like, your job's going nowhere. It's a bigger cloud of things. Mm-hmm. Like, we're not going to just close shop tomorrow and move on. Like, you have that support system of the corporate. They generally provide benefits more, things like that. Mm-hmm. However, the more mom and pop, private practice owned, sometimes the hygienist's, like, voice can be heard a little more. You have a little bit more control on the schedule and things like that because there's not as many guidelines. But also those guidelines can lead to mixed messages and confusion, and there's really not that backup, like, okay, what do I do in this situation? Because even though I've been doing it in 5 years, there's still plenty, at least 3 times a week, I'm going up to the doctor to be like, I don't know how to diagnose this, help me here. I need this help. Yep. And sometimes in that private practice setting, that doctor might not be as on top of hygiene as it can. Because sometimes with the private practice, the doctor really just relies on the hygienist, which is fantastic.
Right.
But if you're I've been in a private practice where I was the solo hygienist. So there's really like my way or the highway, which is great to a certain extent until you have questions. And then he'd be like, I don't know, you're the hygienist. It's like, okay.
You should know.
Yeah, it's like, but I'm not allowed to diagnose. Like, you know, this is
Right.
why I didn't want to be a dentist, because I want to be able to bounce off you and talk to you. So it really boils down to what doctor you're working for, in my opinion.
That's
because
great.
even with corporate, I answer to my doctor, regardless.
Yeah.
So, and then if I'm in corporate and I'm getting in trouble, but me and my doctor at Titan, we're like on the same line, like she's going to stand up, she or he are going to stand up for me. We're going to be that team together. That's like, that's great that you want me to do this, that, and the other, but in this office, this works better. So we're going to do this.
Okay.
And it can be different though. So it's really just what's best for you. Like I'm a single 27-year-old,
Yeah.
so benefits, things like that are fantastic. I need it.
Yeah.
We're a private practice. I'd be, you know, I think my medical insurance is like $300 a month,
Yeah.
you know, for HMO,
Right,
no
right,
coverage.
right.
So that's a burden that, you know, is just coming out of my paycheck then.
Yeah.
So it's really, there's a lot of different settings. My advice to any hygienist looking for a job is you're in an interview, you're also interviewing them. Mm-hmm. So you're interviewing a doctor. When I sat down with Dr. Dhir and Dr. Kennedy, it was really more of a conversation, just like what's your perio protocol?
What do we need? Yeah.
Exactly. How do your new patient appointments run? How much time do I get with recares?
And that was great because we lined up pretty much from the first
It was so
conversation.
easy.
Oh,
Yeah.
wow.
What adjuncts do you have? I came from an office before working with a doctor that had laser. So I was like, I like laser. How do you guys? Okay, we want it in the future. Like there's stuff that's like, okay,
Sure.
we're lining up really well, so it's going to be a good partnership, because that's truly what it is, because she trusts me enough to be taking accurate and proper diagnostics,
Yeah.
so that I could relay information to her, and then she trusts me enough that when I'm like, okay, I'm seeing a gum infection here, I think we need this, that, and the other, she trusts me enough to basically be like, okay, let's move forward, let's do this. Of course she's checking, she's looking at x-rays, she's going to make sure what I'm saying is lining up in the mouth, but it's really a partnership, because I'm an extension of her.
Yeah.
Ultimately.
Yeah.
So if we were butting heads the whole time,
That wouldn't be fun.
it'd be an exhausting work day.
Yep.
You know, if she was either telling me like, no, you need to do a deep cleaning here, and I'm like, no, I don't, or opposite, if I'm saying I need to do it here and I'm over-diagnosing, and she's like, what?
Yeah.
It can get pretty sticky. So
Okay.
it's really, don't be afraid. Anyone in any profession, really, don't be afraid that an interview, it's a two-way conversation. They're not just seeing if they need you, you're also seeing if you need them.
Does that extend to every kind of interview?
Yeah.
Right.
I think so. That's a good way of thinking about it.
Yeah, I feel like
That takes the pressure
especially-
off too, right?
Yeah.
Okay.
And I feel like when you first get out of school, you just like want a job so bad,
Okay.
you know, and you want to be making good money, regardless. Once again, not just dental,
Yeah.
any job.
Yeah.
So it's just like eager to jump into that first job interview
Right,
that you get
right.
like an offer for, but it's really hard after the 5 years to decline an offer. Like I officially declined an offer actually when I was interviewing for you guys, and it was even before I even met you guys. Like I just didn't line up with them.
Sure.
And it's hard because it was like great hours, great location,
Yeah.
all this stuff. But me and the doctor were just kind of like already butting heads a little bit. And I'm like, okay, if we're butting heads now,
Make or break. Yeah.
6 months is going to be like, yikes.
Right.
So, yeah, it's really just the day-to-day. It's going to always, we're feeding off each other constantly. It's a constant conversation between us. Even behind, we try to do most of our conversation in front of patients so that they're part of the conversation, because as a patient, it's your body that we're working on. So you need to be part of the conversation. But even behind closed doors, it's always just an exchange of information, basically. And I think we should do this. Do you agree? Or you should do this. Okay, I agree with that type thing. So that's the day-to-day, where she's more, you know, we're working under her. So we're always deferring to her. Like she said, she's in 3 rooms. I'm calling for an exam over here. Her head's got to be in like 4 different patients' heads. So her day-to-day is much more hectic, where I get to sit down and like focus on a patient. And I'm having one-on-one conversation for 40, 50, our new patient appointments are 90 minutes. So like I'm really building that bond with patients.
Right.
And then I have to come in and transfer that
it's
bond
very
to her.
like we talked about earlier, like the nurse really builds that bond.
Mm-hmm.
But that being said, how much patient time are do you have? And I guess when you do have it, it's probably more niche.
Right. So Kelsey has her full like 60 to 80 minutes with the patient, and then I've got those last 5 to 10 when I come in to diagnose. So the patient trusts Kelsey. She's, you know, they've talked about their their life, about their experiences and everything, I have to catch up. So Kelsey does a really good job of catching me up really quick in front of the patient. And she'll tell her, we talked about this is what she's got planned for next weekend.
Nice.
We noticed,
Yeah.
we'll do all that. And then she'll get into diving deep about, but we did notice she's got gum disease. We did notice that this tooth is hurting her, that kind of thing.
Okay.
So the thing for me is I have to connect with the patient really quick.
Yeah.
Congratulate them on the wedding, be excited about their vacation. But then if me and Kelsey were not aligned and she was telling the patient like, oh,
That
don't
doesn't
worry
look good in
about
front of the
that.
patient.
Yeah.
Oh my God.
So we
And then
spend
she's
a lot
like,
of
no, you've got 5 cavities.
Yeah. So we spend a lot of time when we're training
Yeah.
and when we're, doing team meetings on this is what, if I see this, I'll typically diagnose this and this is why. So they know. So they can kind of be like, usually when doctor sees that's going to turn out to be a crown. We'll let her come diagnose it, but just so you know that's what I'm seeing. That way the patient's already seen it once, they understand it, and they already trust Kelsey to tell them the right information.
Right.
That's what really makes my
great.
job easier.
Yeah.
And that's why it's so important to have team members and staff that are on the same page with you.
Yeah.
Because I've had experiences where I have hygienists who have different ideals or morals or just outlooks on things, and it makes your day really tough because I
Right.
get in there and I'm like, why did you tell them that was going to be a filling? When we've talked about that's probably going to be a crown, and then the patient's like, I'm getting 2 different
Exactly. It doesn't
things.
look good.
Yeah.
Yeah.
And it's how's the patient going to accept treatment or move forward with it when they're like, I don't even know what to believe. Let me get another opinion. So,
And it helps with patients just comprehending too. Like they're most likely to ask me a question than doctor.
Yeah.
Or sometimes it's opposite. Sometimes I'll come in and be like, they have no problems, they have no issues. And then doctor's like, okay, how's everything feeling? And then all of a sudden they get a 5-minute lecture of
And you can't-
this
you
pain's
can't-
here, this pain's here. And I'm just like,
You
I
can't
swear I
stand there and
talked to
she'll be
them.
like,
Don't
I
let it get to
swear.
your ego.
Yeah,
Don't.
no, yeah, I'm just like,
So-
I swear I talked to them for 40 minutes.
Same thing. It's like, let me talk to a doctor.
Yeah.
Right.
And that's fine. I mean, it's like, okay, like that's fine, but this could have been a lot faster process.
Yep. It
But-
works both ways, though. Like, some
Yeah.
patients will tell me, like, Kelsey did a great job, and they're so comfortable with Kelsey. And there's some patients, Kelsey will be like, they didn't really tell me anything. And they
Yeah.
open up and tell me their
Yeah.
whole life. So it's just, it's based on the person.
Yep.
It really is.
Yeah, and it's a day-to-day basis. Every day is different. There's some days where, for some reason, like doctor and I will just like line up and everyone's understanding. There's no questions. Like doctor, oh, we need to do this. Okay.
Can
And
I
we're
do
like,
it right now?
Cool. Okay. And then there's the next day where it's like we have to literally, lack of better words, feel like we're pulling teeth, like trying to just get people to understand what's going on in their mouth.
Right.
But it ultimately goes on the relationships within the office.
For sure.
Because that's when we're vibing, it's easier to hop in
It's
on a
contagious.
conversation. Exactly.
Yeah.
And that's just not just with doctors and hygienists. It also is we have our front business assistants who are our
Right,
front
right.
staff. I have dental assistants. If there's an issue between a dental assistant and a front desk person, everyone on the team knows it because you can feel it in the air.
And there's 11 girls.
It's
But either way.
so it gets real fun.
Yeah. But still, yes.
Yeah, and that's so important because if we can feel it, the patient can feel it.
Yeah.
So that goes back to making the right environment for the patient. So
Okay.
team members are really, really important that we all align on the same values.
Yeah.
Did you always were you always a natural leader, or is that something you had to develop?
Kind of a bit of both.
Yeah.
I would say because I'm the oldest in my family, so like I was saying, I didn't really have anybody to look up to in terms of like this is how things are supposed to be done. So as the oldest, I guess I was called the bossy one. I don't really agree with that, but I'm just kind of used to taking charge and being like, this is what we're gonna do.
Okay.
This is how we're gonna do it.
Yeah.
But I had no training on professionally doing that. I can
Okay.
do that to my brother and sister, no problem.
Yeah,
We're
yeah,
doing
yeah,
this.
yeah.
When it came to leading other professionals and leading other people who a lot of time were older than me when I first
Right?
graduated,
Yeah, exactly.
it was really weird. And I had to really grow into the kind of leader I wanted to be, which at times might not be the best way for every person, but for the team that we have now, they know my leadership style. I'm pretty lax on most things, but I'm going to be a stickler on diagnosis, on this and this and this,
Yeah.
and they know they're not going to push me on that. Where in other things, they can kind of be like, but can we do it this way? And, I'll think
Sure.
about
Yeah.
it. So,
It's nice.
yeah, it just, again, depends on the people that you have in your office with you.
Huh.
And even moreover, Dr. Dhir and Dr. Kennedy also align really well. Me and our other hygienist, we all are pretty calibrated. They're going to hear, besides a couple different vocabulary words, same spiel from
Yeah.
me, the other hygienist. There's not one hygienist who thinks that everyone has periodontal disease and
Right.
one that doesn't. We are all really calibrated.
Right.
And Dr. Dhir knows we're out of the office on Fridays. If one of our patients comes in on Friday, we're not like, oh no, they're going to see Dr. Kennedy. Like it's all.
Yeah.
Oh yeah.
We're all
you
super
trust each other.
comfortable.
Yeah.
We're all calibrated.
Where does that come from? Do you just spend that much time together, or is it some time outside of the office, or like what?
Well, you and Dr. Kennedy have been a team since you graduated, right?
And from what I've heard, this is my first job that I had, my first doctor I'm working with side by side. She's been out for coming on 10 years now, and she's told me numerous times that she's never had a partnership with another doctor the way that we have it. So part of it was luck, but me and her are pretty much, we've never butt heads. Like we can hire someone without I was on vacation 2 weeks ago, and she hired a new hygienist, and I trusted her enough to be like, I don't need to meet her. If you loved her, hire her. I trust you.
Okay,
and I love her now.
Okay.
Like I didn't even meet her during the interview.
Yeah.
So we just align in life, like our morals, and in dentistry with what we expect so well, which is very rare because every dentist is going to give you a different answer for the same question. So that we got really lucky with that.
And what do you like? What questions need to be asked, or like what did you do with Dr. Kennedy to get to that level of like personability and just...
First couple of weeks, we honestly just kind of sat down and were like, what would you do with this? What would you do with this?
Great.
What do you think about this?
Okay.
And a lot of our success comes from our leadership styles are so similar. We're both very hands-on, but at the same time very lax. We're going to give people who have our trust a lot of leeway on what they can do because they know what we expect.
Yeah.
So it's not one of those things, like she said, like if my patients come in on a Friday, I'm not going to be like, oh, that's my patient, only I want to see them. I tell them, I'm not here on Fridays. If you need anything, Dr. Kennedy's going to take care of you so well. And she does the same thing, vice versa.
Right.
So
I'll see a patient on a Wednesday, and they're like, I want Fridays. Like, that's fine. You're not going to see me, which I'm okay with. Like, I'm going to put you with Christina, or I'm going to, like, I'm like, Christina cleans my teeth. Like, I say that. I'm like, they clean my teeth. So, like,
awesome.
They're in great hands.
Okay.
Like, so it's being able to just interchange and, like you said, assistance. And we're like, oh, I need so-and-so to pick this patient because she's, more anxiety. Like, anyone in our office can help anyone.
Yeah.
Okay. Awesome.
And that's the biggest thing, I think, in dentistry is just the relationships. With being a dentist, your options are you can go corporate and you can work with other doctors all the time, which is great because you have more feedback and collaboration. Or you can work in private practice and either own your own office where you're on your own calling all the shots, or have a group practice where, again, you're working with other doctors, but then you're calling all the shots together because you don't have the corporation, which has their systems and everything.
Yeah, and the last two are maybe later down the line after you get some experience. And it seems like you guys are corporate right now?
So we're supported by
It feels
Heartland.
like a small family, but like it's still supported, right? So,
exactly. We have that support system. We have sister offices. We have things like that.
Which is really nice because Heartland Dental is so big. They've got hundreds of offices all around the country.
Oh, okay.
So they've got like all of the research, they have all the data, they have all the things they know that works, which is great for me because I didn't have to walk into the office and make a style for our team, or like morning huddle was an expectation. It wasn't something I had to like invent to have in the morning, that kind of thing. So they have the true and tried things down.
Reinventing the wheel or anything.
Exactly. And I, especially as a new graduate 3 years ago, I loved it because they sent me to all of these courses for CE of things. Like I was at a course yesterday, or a couple weeks ago, I went to Dallas to do a course, and then I did the hands-on yesterday on a patient where we were doing a full smile design.
Okay.
You don't have time in dental school to learn how to do those cosmetic procedures.
Sure.
And had I been on my own, this would have been something I have to seek out, and then I have to fly to, and then I have to pay for, close the office for the day. Whereas here, I was like, it's on a Friday. I had to take one day off Dr. Kennedy covered for me, and I'm with world-class cosmetic dentists who are guiding me. They're over my shoulder with my patient. And that's something that was just provided to me because I wanted to do it.
That's great.
And they were like, of course, we want you to be able to do that in your office. Go learn it.
Yeah.
So it's really, really cool.
Yeah. And just even like every quarter we do a hygiene and a doctor dinner. It's literally just a bunch of us talking about, I saw this the other day.
And that's
How
what I was
would
trying
you
to
approach
get
it?
at. And that's what makes you open up and maybe ultimately a better team together.
Exactly.
Okay.
And we get trainings. We have hygienists that are, that are stellar. They're called hygiene mentors. They'll come into our office, listen and talk and watch me and our team, and then kind of be like, okay, so I think this verbiage would work better. And instead of doing this first, I would do this first because it's more efficient and things like that. So it's really nice to get that constant feedback of how we can improve because everyone can always improve.
You can shoot me down if this is a completely awful idea.
Uh-oh.
But what if you had a hygiene doctor / guest or clientele dinner, and it was kind of like a panel, like a Q&A.
That'd be nice.
With the community. This goes back to like the community and things like that. I don't know. I mean, that'd probably
be really successful.
Yeah,
or
that's
like
actually
a
really
coffee like meet and greet kind of thing, right?
That makes sense.
I don't know. Yeah, just to like break
Take
the ice.
edge off. Yeah.
Yeah, you're not in your white
meet
coat.
us like this.
Exactly. Right. Exactly.
Much more casual, or even more casual. Just
and see if the personalities kind of. Yeah, that'd be cool.
Okay. With how many do you do any of the cleanings now?
Now, not so much because we've got our schedule kind of the way we want it. When I first started out, I would do a couple a week. Yeah. If we were really busy.
Do you think it's a skill that you should like maintain throughout the rest of the career, or like do you think it's not a big deal if you've lost that skill? Do you think you'll be partnered? Like, do you feel like
it's one of those? It's like riding a bike.
Yeah.
When I do it again, it comes back to me.
Oh. Okay,
so it's not something that I need to practice. You know, I have to do it like once a week to keep on it.
Yeah.
I obviously feel more confident in Kelsey because she does it all day,
for sure,
in and out. But if I was thrown into it and we just couldn't accommodate this patient, I had to do it. I feel confident enough to do it.
Yeah. And what she does is much more technically involved as far as like that microsurgery. Like I'm not doing surgery. I'm doing preventative or disease reversal in better, or in lack of better terms, where she's actually going into a tooth and getting into the anatomy. So, I mean, for lack of better words again, like it's easier to do a cleaning, hence why I'm not a doctor.
Yeah.
In comparison to what she's doing. So, like for you, it's like taking manual blood pressure versus using a powered one.
The automated, which the automated is more accurate.
Exactly. But so if you had to switch back to manual, you wouldn't be like, oh, I haven't done this in forever. You'd still be able to do it.
Right.
It'd just be like, oh, okay, we'll switch back, you know?
Okay.
So.
Okay.
Yeah.
With being a hygienist, like how specialized, and I want to go into like fulfillment, right? Like how rewarding or fulfilling is that role if you're doing, and this is from an outsider's perspective, I'm not condescending, it's like
no, absolutely.
From doing kind of the similar things over and over again, day in and day out, where do you get that sense of like fulfillment, and like is there a high sense of dread or burnout because they're doing the same thing over and over? We know the money's there, right? So it's very lucrative, but like that can only take you so far. So
absolutely. So the big thing is, I feel like across the board, hygienists have a very similar personality. Like I'm very methodical in my life in general. I like a schedule. I like when I go to the library for school, I have my list. I get through my list. It's who I am. And I feel like almost every happy hygienist is very methodical, and they like to do tedious kind of work, you know.
Okay.
Even when I clean my house, 99% of the time, I'm going to do it in the same
way,
order that it is. So just being very organized and having that personality, I think, is what makes it fulfilling.
Okay.
But what does fulfill it, honestly, is the bigger cases. Like the people who come in and have never seen a dentist, or haven't seen a dentist in 10 years because of X, Y, Z.
Sure,
I mean, there's a million reasons why people don't see it.
Sure.
Life's too busy, lost insurance. There's a lot of different things.
Yeah.
And getting that success rate, because really what we're trying to do as hygienists is avoid surgery because we don't want to involve the periodontist. So I could go work for a periodontist and be doing deep cleanings all day if I wanted to, which is awesome. That's really like the highlight of my day are those deep cleanings. But in my opinion, that's more burnout than having kind of my mix of things. Like I have a bunch of recares, and I'll have a deep cleaning, but then I'll have a kid after who I get to goof around with and ask them how, you know, Secret Life of Pizza 2 was and stuff like that. Like, so it's more like getting that connection and connecting with people. That's my fulfillment. And seeing that light bulb go off. Like when I talk to them 3 times about getting a power brush, and then they go get it and they're like, that was, it makes a difference. I'm like,
you had a part in that.
Exactly. I'm like, thank you. You did, like, now I don't have to bug you about it every time. So I think it's more like when patients listen to us as hygienists and like they make those changes. They come in and their mouth might be a mess, but it's a year later now and they have healthy gums, and you know, they've really turned their life around, because I know, which I talk to them lightly about, but I know all the bacteria that's not getting in their body now. I know their risk for heart disease have gone down. I know their risk for Alzheimer's has gone down. Like, I know all the stuff behind it of why I think it's so important. And when nurses come in, I talk to them about it, because that's easy. Or an EMT comes in, I'll talk to them about bacteria and the inflammatory response and all that
let's go
stuff.
Deep. Yeah.
Exactly. Like, let's do this. Let's use all the medical terms.
And they get it right away. You're like, that was the easiest conversation.
Exactly. But for the regular person, you know, I'm not going to be talking about P. gingivalis and how it causes periodontal disease. stuff like that. But just seeing that light bulb go off with a patient is really like such a like, this is why I do it. Like, because we might even have frustrating week, frustrating month where I feel like no one's getting it. Like I asked doctor to listen to me. I'm like, am I using the right terminology? Am I getting too specific? Am I getting too loose? Like, can you help me out? Am I doing something wrong? Right. And a lot of times I'm just using the same stuff. So it's like, no, it's just kind of luck of the draw.
Right.
And then all of a sudden you'll get like a big case acceptance that someone realizes like, this is a serious infection. This is something we need to take care of ASAP. Like, let's start today or do something like that. And it's like, this is why I do this.
Exactly.
Yeah, it's like, this is why I do this. And this is why I got into it, because that oral systemic link is just like, it's so crazy. It's so, I guess because I'm young, I'm only 27, so I'm younger. I'm just like, why didn't people think of this before? Like, why is this a new thing? It's absolutely crazy.
Yeah, how did we just find this out?
Yeah, how are we just making these links as science, progresses? But it's really cool. And yeah, so really that patient, like, I guess, absorbing and comprehending everything, because we throw a lot of information at patients very fast. It's overwhelming. If it was, roles reversed and I was at a, orthopedic surgeon, he was telling me, I'd be like,
what did you say again?
Yeah, what's going on in my body? So I don't blame people at all for not grabbing onto it right away, because it is such a taboo subject of dental health and prevention and things like that. So yeah, really just that patient understanding, wanting to move forward, wanting to better themselves, because that's all we ever want is, patients will all the time be like, I haven't been flossing every day, but I've upped it to 3 days a week. I'm like, that's awesome. Let's celebrate, because
taking ownership of it.
Yeah, you're not going to just all of a sudden be perfect.
Yeah.
No one's perfect.
Or creatures of habit.
Exactly.
Yeah. Is that something similar for the sense of fulfillment for you?
I would say it's actually really different.
Oh.
So as a dentist, you can do as much or as little as you want. So I love cosmetics. I love orthodontics. So I do a lot of Invisalign. I try to do a lot of like veneer cases, that kind of thing. 'Cause that's what makes me really happy. I feel like it changes everyone's image of their smile and their confidence. I love that feeling. But on the other hand, I also love doing root canals. A lot of dentists don't like doing them. They're very time consuming. They're very technically... you need a lot of technical skills for it, so it can be stressful. But like I said, I love when the patient comes in pain and I'm like, boom, an hour and you're leaving and you're able to sleep tonight.
Wow.
So I don't love, big surgeries like jaw surgeries where oral surgeons do love that. So I can pick and choose the things that I love to do and make that my focus.
Okay.
So it's every day is different for me. Okay. It's not just the drill and fill every single day.
How many different focuses can you have as a dentist? Like if there's like endotonics or whatever, what can
so you could be like,
it's limitless, it seems like.
It pretty much is, and not everyone's going to be good at everything. So I don't want to be dabbling into
master of none kind of thing.
Exactly.
Okay.
But you can be into root canals, you can be into cosmetics. Some people have their whole practice just on cosmetics, doing just smile designs all day, every day. As a general dentist, you can pick and choose what you want to do, but you're held to the standard of a specialist. So if you're going to dabble into root canals, you've got to be very confident that you're doing it really well, because if it fails... Is it
an actual another set of boards or what?
No, that's a nice thing. You can just take as much CE as you need.
And then just say you can do it now?
Yep.
Really?
Same with implants, same with Invisalign, all that kind of stuff.
I
can learn
insane?
wire bracket.
Because when I first found out about that with being a physical therapist or a chiropractor, they can just add on these things like dry needling or acupuncture and all that, and they can just start practicing after taking a CE on it. It's like, what?
So it sounds insane, but I think doctors across the board, our biggest downfall is how high of a standard we hold ourselves and our patients to. Okay. So no matter how much I love something, if I'm not confident in it, I'm not going to do it on my patient. And my assistants will ask me sometimes, that impacted wisdom tooth, why didn't you just say yes to it? We've done it before. And I'll be like, I wasn't confident that I would be able to get it out in a timely manner for the patient, and they're going to be more swollen, they're going to be have more post-op pain.
Yeah. And I'm sure
I could probably do it.
Not all dentists think that way, though.
I think a lot of them do.
Okay.
I hope they do. And
you would hope, yeah.
From all my medical friends and my dental friends, we all really do put ourselves to that high standard.
The best
not
interest
just
of the
because,
patient.
yeah, exactly. Not because I'm worried about someone coming and jeopardizing my license, but because I care for my patients and I don't want to.
No one has that ego of I got this.
I mean, you're gonna find that in any situation. I think not just dental.
Right.
But that's where it comes to gauging your doctor and knowing like she would take care of it. And that's I have worked for those dentists that are like, I'll just place that implant. I'm like, really? Like, you really think they should do? Like I know you've done implants before, but you really think you should do that one? Yeah. And that's why, like as a hygienist, I've left jobs before because she could right now go into a mouth technically and place an implant, but she's gonna know that what's best for her. So I feel like Doctor said, the new wave of medical and dental, it's like the general practitioners, whether it's a dentist or a general practitioner, medical, they're trained a little bit on everything, but it's really knowing your dentist and knowing your provider and knowing that like she'll say exactly like she'll say to a patient like I could do this,
but you'd have a better experience with the oral surgeon who does it all day every day.
Right.
Yes.
Right.
And there are some dentists I know who will just do crown and bridge because that's what they are comfortable with and they love it. I guess maybe because I'm a new dentist, it's only been 3 years, I'm really open to learning new things and diving into new procedures. So if I have the opportunity, I will.
Yeah.
And I'm always seeking out opportunities for mentors to like be over my shoulder and show me more things. So it might just be an age thing. I don't know. I love trying new things and being able to offer that to my patients.
Right.
I think
and you go into dental now knowing whether it's hygiene or dental. Like they tell you, like you are going to be learning until you're done with this career because we're required C's to renew our license to start off. But you could take mediocre, and you could take mediocre C's if you wanted
just
to
do it,
and just to get it and do it, or you could take them like the one that she just did that is a total smile design. She could have done that, or how to prep a crown. She knows how to prep a crown.
Right.
So it's an internal drive to do better also.
Yeah.
And things are always changing. Like a couple of years ago, implants were not what they are now. Veneers 30 years ago are not what they are now. Like you have to keep on top of things to be able to provide the best treatment to your patients and the most up-to-date treatment to them as well.
Okay. Kelsey, do you have this feeling or do you know another hygienist that feels this way of like maybe I should have gone to dentistry school?
We actually had a hygienist just leave us because she's went into dental school.
Wow.
So it does happen, absolutely.
Yeah.
I see it less often than just shifting in general, like getting out of it. And then even rarely, I feel like even people like me who want to go into research is even more rare. I feel like most hygienists are actually like really content and like okay with being a hygienist. There's nothing wrong with that. It's a really fulfilling job if it's what you like to do, if you have a good team and you do get to interact with people all day. Like Doctor said, you're never going to be sitting behind a desk all day cranking away at numbers or things like that. But yeah, it's much less though, because as far as us, the only thing we could do really is expanded function. So like we could use a laser or using newer like antibiotics underneath the gums and stuff like that. We are much more limited because we are not the doctor.
Right.
Or, I could go work for a periodontist that does do crazy deep cleanings, and there's this thing called a flap surgery where they pull back your gums and then you clean underneath and then you seal it back up. So that's what we try to avoid in our office is I want to do deep cleaning now without that.
Yeah.
So we could avoid the surgery. So like there's other ways you could go deeper into hygiene, but as far as like expanded functions, there is a new thing on the wave that's an expanded function therapist, which is I would be able to do, if I got my licensure in this and it became legal in Illinois, I could do simple fillings as a hygienist.
But then it's like, why not go all the way? It's like...
Agreed.
Yeah.
And it's supposed to be utilized more in public health. So it's supposed to be, because it would be less costly, because we wouldn't be a doctor. And you'd increase access to care, basically. So that's like the main reason behind it.
Yeah.
But it's something that like in my opinion, I would just go full dental or like I'm trying to go into research. So like I'm just going to shift totally instead of just being a hygienist who could do simple fillings. But in other office, like it's really big in Alaska because it's so rural. They're already practicing because it's so much rare to have, they don't have dentists on every corner like we do in Chicago. They don't have 50 dentists in Orland Park between 143rd and 179th. Like, it's just not as accumulated there. So it's really more shifted towards that public health and creating a greater access to care.
Okay.
Yeah.
But most hygienists that I've interacted with, I can tell they're fulfilled because I have 4 assistants. 3 of them want to become hygienists.
Oh, wow. That's great. That's a great testament to that.
It's really cool to see because that must mean that they're portraying how happy they are to the rest of the team.
You're right. Yeah.
Like they'll come to me and they'll be like, can you help me figure out what I need to do what Kelsey does? And that is the biggest compliment for not only Kelsey, but for me. Because I'm like, she must love doing what she does if she's making someone else think that maybe that's what I want to see for my future too.
Is there a big difference between the work-life balance between you guys?
We're very similar because we have similar lifestyles, I feel like. Besides, she's married. But besides that, we both like to socialize and then also take care of ourselves. So we luckily, with that support from the other offices, if I need to go on vacation, it's not I mean, I can't tell her next week, like, hey, going to Florida next week. Good luck with patients. But as far as like, hey, I have a trip planned in a couple months down the road, we do have the sister offices that we could pull a hygienist from there for my Monday and then pull another one for my Tuesday. And so it's really nice. That is one of the plus sides, I think, on the corporate end is you do have that support. And like for her, at least, she's not the only dentist in her office. So Dr. Kennedy will cover for her.
We cover for each other,
Nice.
And that's kind of the nice thing about having Heartland support is if I was owning my own office or I was in private practice, I do have to worry about like the marketing, the hiring, the pay scale and everything like that and making sure everyone's getting what they deserve. Whereas when I was on vacation a couple of weeks ago, I could just check out and I knew the office was going to run fine. It would still be there when I came back.
Yeah.
Whereas, so I think the work-life balance for dentists really comes from if you're owning your own office or if you're under a corporate heading.
Okay.
The main difference there.
Okay.
And then for me, like I work technically 3 hygiene jobs. So I'm with Dr. Dhir Monday through Thursday. And then I have 2 different offices that I'll temp at with on Saturdays. Oh. And it's nice though, because I literally, that's to me, like that's my fun money. Like my Monday through Thursday, that's my bills, that's my groceries, that's, keeping me happy and stable. But if I like, now that it's summer, I picked up a couple extra because I know I'm going to want to go to a couple concerts. I'm going to want to go to Six Flags or whatever it ends up being. Yeah. So like that's where hygienists have a little bit of flow is like we can do what's called temping. And doctor could do that, but it's a little harder to be like, let me just do this filling I've never seen before.
Right.
Where me, I'm not just cleaning teeth, but it's a lot easier to hop into that.
Yeah,
if that makes sense.
That does.
And that's not mandatory. Like there's some hygienists who will just do their Monday to Thursday and they're fine. Yeah. So it's very much your lifestyle and what you kind of want to get out of it.
Oh, interesting.
Yeah.
What's next? Do you guys, it sounds like you guys are so happy like where you're at. So I was going to ask a private practice, but like it's like you guys are so happy where you're at. So like maybe 10 years down the line, where do you think you guys would be?
That's a loaded question because when I graduated, I was like, okay, I'm going to work with Heartland. I'm going to get all this extra CE. I'm going to like figure out how to run an office. And within 3 or 4 years, I'm going to open Dear Dental. That was the dream. Dear Dental. I already had the logo.
There's
I had
a
the
ring
name.
To it.
Yeah, it was all ready to go. And then
got your dream team. Kelsey's coming with me.
Yeah.
Oh,
we joke about that.
Dr. Kennedy would not be happy with that.
No, you're coming too, Doc.
Yeah. Right.
And then things just kind of fell into place. Dr. Kennedy and I were really aligned.
Yeah.
We've got this fantastic team now, and I'm really comfortable where I am. My patients are finally, they're like, you've been here 3 or 4 years. Like, we love seeing you. You're doing good work. I'm just really happy with my hours. Like everything's just kind of working out really well. So I put Dear Dental to the side for a little bit.
But maybe in 10 years.
But so I'm doing more of like a 2 to 3 year plan instead of a 10-year. But I think the ultimate dream for a lot of dentists is you open up your own practice. Gotcha. You have all the say. You run it the way you want it to be, and it's your baby. And that's
maybe you guys are slowly figuring this out. But like, why do I need all the say if I'm like completely happy here?
Yeah, that's the thing,
right?
It's more lucrative if you're on your own because corporate takes a certain amount of the profit in the office to run things. So I can allocate things in different ways if I own it myself.
More money, more problems.
That's the thing. When I go on vacation, I'm going to have phone calls from people. I'm going to have things to deal with. It's not going to be a checkout situation. So it really is a personal decision. But I do think at the end of the day, that is going to be the dream that I want to fulfill in 10 years. Yeah. One day. For sure.
Kelsey, doing research? What are we doing?
Well, finish my master's.
Congratulations.
Yeah, woo! So that'll be next year.
Right on.
We could be happy then. I gotta get through the thesis. You got this. And then either like research, like with the oral cancer coming up. I feel like hygiene hasn't had a big breakthrough in 15, 20 years. Like finding the next breakthrough would be so cool. Then you guys could all say, you know me.
Hey.
And stuff like that, like just finding the new stuff, because I feel like dental is just so unexplored that there's just so much we can do. And there's other, like I've worked at the office before where we did oral antibiotics when they had periodontal disease, like looking at those, like there's just so much difference. And for the mouth, it's all bacteria. We're just dealing with bacteria all day. So there has to be something, like something's got to give. There's got to be something that can, like, a know-all cure or like there's gotta be. I obviously we don't know what it is, or else we would have much different jobs. But really just trying to go to that is really what like excites me. Or public health, like just increasing that access, or fighting with dental insurances to make it more like a medical coverage, or things like that. Like there's so much out there that I do want to expand my functions. I do want to kind of transition out of the clinical role, but I'll never let my license lapse or anything. Like I'd always want to be able to be like, Dr. Beck, hey, we are in a tight bind. Can you pop in on Wednesday? Something like that. Like I'd never want to fully lose those skills, because I have worked the past 5 years. And then by the time I graduate, 6 years, you know, fine tuning myself and really staying on top of it, that I don't want to lose it. But I really kind of want to be more in like the research or advocating, like working for the ADHA and doing things like you were saying, like setting up these forums and just increasing education and making PSAs and stuff like that.
I saw a video, this is a while ago now, of a barber going around town to the homeless population and just giving free haircuts.
That's so nice.
It'll be a little tougher for you guys, but what if you went around to like the underserved areas, maybe shelters, and provided screenings and cleanings and things like that, basic stuff that they need. Is that easy to do?
We were just talking about that with a patient the other day. There are trips to underserved areas all the time. So he goes to Africa, he goes to South America,
Ecuador, stuff like that.
All that kind of stuff. So I did it once in dental school, and I've always said, like, I want to kind of make it a thing that I'm going to do every couple of years.
Right.
So that's a really nice way of giving back to communities, because when I went, a lot of them, that was the only time that year they had seen a dentist. They were lining up in the rain around, you know, the building. So that's the best feeling.
It's interesting. I can picture the line, you know, circling and stuff like that, but like, it feels like they understand how important it is.
They do.
And it's so crazy they have to battle with these people, like trying to plan them out.
Now, would it be a little more bureaucratic to do it in the underserved areas in the U.S.? Would it be tough, like hoops you got to jump through?
I don't know. I would love to do that.
What if you just popped up in a homeless shelter and just be like, free screenings, free cleanings?
Yes.
So I talk at a halfway house often in Harvey. It's called the Harvey House, and there's a men's house and a women's house. But every morning it's a Christian-based group, so they come together, they pray, and then they have a meeting every morning. And I go there probably like seasonally, so about 4 times a year, and I just talk about home care. I mean, stuff that they can control, because I'm not going to just talk about how important it is to go to the dentist. Like, they have a lot on their plate right now. I'm sure the last thing they're worrying about. It's like, I need to go get my yearly cleaning is probably the last thing on their list. So I really focus on what they can do on a day-to-day basis to change and to help prevent these things. And if you do have a cavity, how to at least slow it down until you can get on your feet, get to a dentist, things like that. And you'd be surprised how many people stay back after that meeting, and we're just talking and hey, can you look at this? I mean, I meet people at the bar, and they'll be like, "Ooh, you're a hygienist, let me look at this," and I'm like,
"Now, really,
just trying to have beer here, you know, like, calm down." But I get it. It's like there is this like unknown thing that you hear, like I'm sure same with you. I'm a dentist. Oh, what's this look like?
I have people opening their mouths and asking me to look.
Hey, Doc.
What do you think of this? They said I need a crown. Do I really need a crown? Can I just keep this filling?
And I mean, I'm sure doctors get that, like that joke, like, oh, let me show you this rash. Like, it's just
a thing.
It's there's a need out there. I think everyone can agree that there's a need. The question is, how do we get that need served?
Right.
And that's something I would also look into, like, because there's nonprofits, there's things that happen, but it's one, not known about enough, and two, there's not enough of it, clearly, because there's still people in need. And even when you go to the schools,
which is so funny because we already talked about how saturated it is.
Yeah.
It's so crazy.
It's like it's only saturated if you have money or something like that. And even the schools, even though they're severely discounted, it still can be costly. I mean, at the end of the day, once again, it's microsurgery they're doing. It's not easy stuff that they're doing. It's not. You could be compromised very easily. So,
but I feel like people don't realize there are a lot of public health offices in the city as well. I've got a friend who works for them, and she sees Medicaid patients all day. Medicaid covers a lot of extractions, simple fillings. Some even cover crowns, that kind of thing. So the care is there. The places are there. People just don't know about them as much. So I feel like if you have insurance, if you have Medicaid, just call up your provider and ask them, like, where can I go? Where am I covered?
Now, what percentage does Medicaid pay back if you know that? And is it enough to sustain that office? You know, it's like...
I think they pay pretty well, actually.
Right. That's not what I hear from EMS, so...
Yeah, I think for dental, it's pretty... I did a paper on this, and I really should know more, but
for the patient or for the doctor?
For the doctor.
Yeah.
You know, we know it's covered, but, like, for the doctor to be able to sustain that office, keep it open, does that doctor just come on their free time and volunteer, or is that their full-time job?
That's their full-time job.
Yeah.
And you're salaried. With incentives.
Okay.
That's the understanding that I have. But the main incentive is for people who have federal loans.
Exactly.
You're taking the lower salary because they have the forgiveness. There is, a reason that, or incentive for doctors to take that lower salary and serve this underserved community as well. It's kind of, win-win for everybody.
It's just like how several people will join the armed forces to get the education. It's very similar.
Back and you don't have all the debt when you graduate.
Exactly.
So, yeah. Personal decisions.
Yeah.
But there's a lot of them.
Okay.
Sure.
Last thing, just like any advice for up and coming hygienists or dental students, like what is the ideal dentist and what's the ideal hygienist? And I hope people have just like picked up on it throughout the whole interview. But if you were just to impart some like last minute wisdom, like what would you guys share?
My main thing I've learned through the process is never give up. Dental schools look so scary with all the admission requirements and the numbers. Just apply broadly. If you want to do it, you're going to get in somewhere. And you might not get in the first time. You might be waitlisted. You might have to try 2 or 3 times. But if that's what you want, go for it. And
So don't apply because you didn't get into med school.
Well, I didn't apply to med school.
I'm not talking about you.
Oh, okay. I originally wanted to go to med school.
No, I'm not talking about you.
Okay. Like other people.
Have you heard like, oh yeah, I just didn't, get it into something else?
It's equally as competitive.
Exactly,
in
right?
all
So
honesty,
it should be like long before you actually apply.
Yeah, that's the thing that you want to do. And if that's what your heart is set on, don't give up on it. You'll love it. And you're going to change a lot of lives. You're going to be really happy, every day when you go home because you were sitting behind a computer punching in numbers. You were changing people's lives.
Right.
At the end of the day.
Right. I like that. Any last minute wisdom?
Just make sure, because we do work under dentists, that you are partnered with someone that you get along with and align well with. And don't be afraid also to stand up and,
just be confident.
Be confident in yourself. Like the schooling that we go through, even though it's shorter than a doctor, they teach you what to do. Follow your gut, because chances are if you're all the way out of school, you've gone into this for the right reasons. You're doing it because you want to help people. So listen to your gut, but also be open to guidance and understand that like it is an ever-changing field and things are changing. We're coming up with new codes. We're coming up with new procedures all the time. Yeah. So just be willing to learn, be willing to absorb, and work with someone that you really understand with. So you can have a conversation when the far and few in between where we might not line up. We could kind of say why we're thinking what we're thinking, and then generally one of us will be like, oh yeah, you're right. We never walk away from something and be like, I'm doing something wrong. Like sometimes I'll think this should happen because of XYZ, but then doctor reminds me because of ABC, and it's like, you're right. And it could be vice versa and things like that. Sometimes I'll see something in a cleaning that she might have missed if she did the exam early, and just really...
It's funny, a lot of it doesn't even have to do with teeth. It's just like...
Yeah.
It's all the relationships.
Yeah, it's all relationship, because it's medical. So nothing's going to be textbook once you get out of school. And you need to be malleable as a hygienist, but also be firm with your ethics and morals, because you do work under a dentist. So you are, for lack of better words, answering to someone. So you want to work with someone that you line with and that also you have that trust with, because that's huge. I would never have my mom come and be like, oh, I want her to see Dr. Dhir, not Dr. Kenny, or vice versa. Like, either one of them could see my mom, and I'd be like, yep, their opinion is valid. So, yeah, just be confident and focus on relationships mostly.
Definitely.
Wow. Okay. Well, thank you guys so much for coming on. It was a very enlightening conversation for me, probably for the guests as well, for the people watching as well. But, you know, for everyone watching, where can they find you?
So our practice is Family Dental of Orland Park.
Yeah.
And we've got a Facebook.
Okay.
We can find us on there, and we are in Orland Park on 179th, so you can call us anytime you have any dental needs at all.
Yeah.
708-478-5093.
Oh, look at you. Got
that memorized.
Got it memorized.
All right.
I'm always calling patients, so that's why I'm just so used to it.
And
we're making calls for doctors.
What if they had questions about school or experiences and things like that?
Open to that 100%.
Yeah, just call the office, or like, is there like social media? Are we keeping that off the books? Or
no, I mean, whatever. You could tag us in your post.
Yeah,
I don't mind.
That's totally cool.
Right,
and if they do call the office, I mean, I'll pick up the phone. I'll come in and talk about that kind of thing.
Yeah.
It's not one of those things where I'm going to be like, oh no, like you have to message me a certain way.
Yeah.
So
Right.
totally cool with that. And I think having a mentor is so important. So you know, if you are totally in love with dentistry and that's going to be your path, I'm totally open to answering any of your questions.
That's amazing.
Or if you want to come shadow, like doors are open. We're a very transparent office. So
need more of that.
Yeah, anyone who
Do you
wants
guys
to
go to
come
like
through.
high schools and stuff like that? Be like,
I want to.
career day and whatnot.
I really want to, especially like I went to D230, which is 3 schools. Like that'd be so easy. Colleen works at Stag. Like it's something that we could get easily involved in, and it's something that, especially like we have Fridays off, which is a very big luxury. So that makes us very available to just talk to people. And everyone in our office, all clinicians, have at least 1 day off. So it's really nice that
we have that one business day to like get out there and people are, you know, on their 9 to 5 job where we can still go and meet them.
Yeah.
So
and we love it. I mean, it's the best way. Like I said, word of referral. There's nothing better than if someone called us like, we saw you on the podcast and I want to come be a patient.
That would be the best.
Yeah, it'd be so awesome.
Yeah.
But yeah.
All right, cool. Well, guys, don't forget to stay curious. I will see you in the next episode.